Council for Thursday, May 14th. And let me first go to the clerk again under the particular circumstances that we are under so that everybody's clear. Madam Clerk.
Good morning. I'm going to briefly review the rules and protocols for electronic participation in this regular council meeting. During these meetings, we continue to comply with provincial orders and public health orders and recommendations to support social distancing, as well as prohibiting public gatherings of more than 5 people. To that end, this meeting is being streamed live from the Region of Peel website, and we encourage the public to stay home in accordance with provincial and public health recommendations and listen to the proceedings from there. We are actively screening all those that are here in person. Further, we have purposely spaced people in the chambers more than 2 meters from each other to maintain a physical distance. The people present in council chambers are Chair Yanika, myself, and clerks and IT staff sufficient to facilitate the technology and procedures for this meeting. There will be no more than 5 persons in the chambers throughout the meeting. We are conducting the meeting using Webex. If you are dialing in, please note that you will be required to identify yourself so that we can update the system with your name. Connecting to the meeting via dial-up is not a preferred method because of connectivity is limited. For an optimum Webex experience, we ask you please to take the following measures to avoid feedback and confusion with members speaking over one another. Please keep your microphones muted unless you have the floor to speak. Please use a headset and avoid using hands-free devices or speakers. Please speak loudly and clearly when you have the floor. Please ensure that any surrounding environmental noise, such as television, radios, and pets, is eliminated. The recommended Webex meeting display is active speaker video view or active speaker and thumbnail video view so that you will have a full view of the presentation slides and other meeting materials. During a presentation, we recommend that you close your participation list so you have a full view of the presentation slides. If you are experiencing a poor Wi-Fi connection, please disable your video. If you drop off the meeting, please rejoin, and if you have difficulties, please contact your local IT department first for assistance, following the same process you do for local council meetings. As required, your local IT department will reach out to regional IT staff for further assistance. Thanks for all the technical staff of the cities of Brampton and Mississauga and the town of Caledon who are standing by to provide assistance to the respective councillors. The collective technical staff have done an excellent job pulling it all together. The video function for Webex has been activated, so you may choose to turn on your video. You can choose to leave it on throughout the meeting, or you can turn on your video only when you are speaking. If you don't want to activate the video feed, you are not required to do so. We will still hear you, just not see you. We have also activated the chamber cameras for this meeting. During staff presentations, the slides will be visible on your screens. If you have difficulty viewing the slides, they were all provided to you in the revised agenda that was distributed Tuesday. Those participating electronically will not have access to the usual request to speak button. If you wish to speak, please click on the round participant icon at the bottom of your screen to enable your participation list. To indicate your request to speak, please raise your hand by clicking on the hand icon located to the right of your name in the participant list. Your hand icon will turn blue when engaged. Members who connect to the meeting via the dial-in option can send an email to council@peelregion.ca and you will be added to the speakers list. When called upon, please unmute your microphone and proceed. When you have concluded your comment or question, please mute your microphone and lower your hand by pressing the then blue hand to the right of your name in the participant list. After the response, the chair will circle back to you for any follow-up and confirm that you have yielded the floor. If you have any motions or amendments to introduce regarding today's business on the agenda, please email your motion to council@peelregion.ca, identifying yourself as the mover and also identifying the seconder for your motion. If you do not have a seconder, the chair will call for a seconder. If you wish to second the motion, please send an email to council@peelregion.ca and the first email received will be deemed to be the seconder. Each motion will be read in its entirety prior to calling a vote. Voting will be conducted verbally. For procedural votes that do not require a recorded vote, I will call for any objections. If you have an objection, please unmute your microphone and indicate your name and objection. If no objections are stated, the motion will be deemed to be adopted. For recorded votes, I will call upon each member in alphabetical order based on last name. Once called upon, please unmute your microphone and indicate your yes or no vote. I will confirm the vote for each member. This process will take some time, so please have patience. If you do not respond when called upon to vote, I will call your name a second time. If you do not respond to the second call, you will be recorded as abstaining from the vote, and your vote will count in the negative as a nay vote. I will be calling roll call. Please indicate your presence by responding here when called upon. If you are leaving the meeting, please send an email to council@peelregion.ca to indicate that you are leaving the meeting. If you have left the meeting for any votes thereafter, you will be marked absent. If you don't advise that you are leaving the meeting and you don't respond when called upon to vote, you will be considered to be abstaining, and a vote will be recorded in the negative as a nay vote. It is very important that you advise if you are leaving the meeting. If the meeting should move into closed session, those members who are participating remotely must ensure that no other person is in the location from which you are taking part in the meeting, or make appropriate arrangements so that any other persons cannot see or hear any of the confidential deliberations taking place. If this is not possible, the member must withdraw from the meeting until it has moved back into public session. Prior to moving into a closed session, members shall declare that they adhere to the confidentiality standards as outlined in the Regional Council Code of Conduct. Members who leave the meeting during the in-camera session and attempt to connect back via the dial-in option will be required to send an email to council@peelregion.ca indicating their request to rejoin the meeting. We will temporarily pause the in-camera session and unlock the room to allow you to join. You will be required to identify yourself upon joining the meeting. If you have any questions as we proceed through the meeting, please send them to council@peelregion.ca together with a request to speak. We should now commence the meeting with roll call. Mayor Brown. Mayor Brown.
I'm present. Can you hear me?
Yep.
Yes, we can. Thank you. Councillor Carlson.
Here.
Thank you. Mayor Crombie.
I'm here, and I hear that Councillor Starr is here as well. That's his quacking. Madam Clerk, I think
Yes.
Mayor Brown and I, at least I do, I have to leave at 11:30 for an emergency LUMCO meeting.
Thank you. I'll note that. Councillor Demurla.
Yes.
Thank you. Councillor Dasco.
Yes.
Thank you. Councillor Dillon.
Yes.
Thank you. Councillor Downey.
Present.
Thank you. Councillor Fonseca. I think I can hear her unmuting her mic. Councillor Fonseca. I'll circle back. She shows present in our meeting participant list. Oh, thank you. Councillor Fortini.
I'm here, thank you.
Thank you. Councillor Groves.
I'm present, thank you.
Thank you. Councillor Innes.
I'm here.
Thank you. Councillor Kovac.
I'm here.
Thank you. Councillor Mahoney.
Good morning. I'm present.
Thank you. Councillor McFadden.
Good morning, everyone, I'm here.
Thank you. Councillor Medeiros.
Here.
Thank you. Councillor Paleshi.
I'm here.
Thank you. Councillor Parrish.
Here.
Thank you. Councillor Raz.
Present.
Thank you. Councillor Sato.
Here.
Thank you. Councillor Santos.
Here.
Thank you. Councillor Sinclair.
Here.
Thank you. Councillor Starr.
Present.
Thank you. Mayor Thompson.
Good morning, I'm here.
Thank you. Councillor Vicente.
Present.
Thank you very much. I'll turn it back to you.
Thank you all. Now that brings us to our Indigenous land acknowledgement, Madam Clerk. Thank you. We would like to begin by acknowledging that the land on which we gather and which the Region of Peel operates is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabeg, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, and that is also home to the Métis and, most recently, territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have this opportunity to work on this land and by so doing give our respect to its first inhabitants. Okay, next, declaration of any conflicts of interest. Hearing none. Approval of, might we have one? Councillor Fonseca, are we recognizing you for a conflict of interest?
No, Mr. Chair, this is with regards to an added item.
Oh, very good. Okay, let me exhaust the conflict of interest first. Was there anyone with regards to a declaration of conflict of interest? Seeing none, I now go to item 4, approval of the minutes from the April 23rd, 2020 Regional Council meeting. The minutes have been moved by Councillor Carlson and Councillor Dillon. Madam Clerk, a recorded vote on the minutes?
No, just any objections.
Are there any objection to the minutes of April 23, 2020? Seeing none, those are approved. I now come to the approval of the agenda. Councillor Fonseca, I see you on my list. Please proceed.
Thank you, Chair. Yes, I wanted to add an item under 21 other business councillor inquiries. It's with regards to the announcement by FCM of a COVID-19 community response fund for vulnerable populations. If I could add that. It's just to comment on it.
Thank you. The clerk is asking whether you'd like to add it under our COVID presentations. I'm thinking
that would be appropriate as well.
Very good. I will acknowledge you at that time. And next on my list, speaking to the approval of the agenda, Councillor Parrish.
Thank you, Chair. I would like to add, wherever you deem it suitable, a verbal update on the surveys associated with the search for the CAO.
Thank you, Councillor Parrish, and the clerk has already advised me of that, and we will assert it accordingly. Councillor Demerla.
I just wanted to make sure I have an opportunity to talk about long-term care and the health section.
And
ahead of time.
Yes, and Councillor Demerla, we've acknowledged that you've reached out to staff with regards to that, and we will be adding that at the appropriate time as well, and we will be acknowledging that in the approval of the agenda. So, if there are no other inquiries regarding the approval of the agenda, Madam Clerk, if you could read the motion with regards to the amended approval of the agenda.
Moved by Councillor Fonseca and seconded by Councillor Parrish that the agenda for the May 14th, 2020 Regional Council meeting include an oral item regarding long-term care homes in the region of Peel to be dealt with under COVID-19 related matters 8.11. And further, that the agenda for the May 14th, 2020 Regional Council meeting include a communication from the City of Brampton regarding installation of sharps receptacles in downtown Brampton to be dealt with under COVID-19 related communications, item 9.6. And further, that the agenda for the May 14th, 2020 Regional Council meeting include an oral update from the Regional Council Policies and Procedures Committee regarding a survey related to the search for a Chief Administrative Officer to be dealt with under other business, item 21.2. And further, that the agenda for the May 14th, 2020 Regional Council meeting include an oral update from Councillor Fonseca on the FCM update on COVID as item 8.12. And further, that the agenda for the May 14, 2020 Regional Council meeting be approved as amended. Calling for any objections? Hearing none, motion pass.
Very good, and that deals with the approval of our agenda. I will now go to our consent agenda. We have several items under COVID-related matters and presentations. Madam Clerk, a point of clarity on that?
Just to facilitate the consent agenda item, Chair Yanika will state each item number and title in the order it appears on the Regional Council agenda. Should you wish to hold the item, please unmute your microphone, identify yourself, and state hold. After the Chair has gone through the entire agenda, he will circle back and read all of the held item numbers. If we have missed any items that you want held, please unmute your microphone, identify yourself, and state the item number you would like to be held. The chair will then proceed to call the vote for the consent agenda. It is a recorded vote, so I will be calling out the names of each of you and confirming your vote. Thank you.
Thank you. With that, the first batch of items we have are under 8 are all the COVID-related matters. But Councillor Fonseca, to you, I think it might be appropriate that I will be acknowledging you specifically after we've dealt with 8.1, the update from Nancy Polzinelli, and 8.2, our medical officer of health. After that presentation, I think it might be appropriate to yield the floor to you and speak to your motion from FCM and how it relates to all of the above. But with that, all other items on item 8 will be addressed, which brings me to the consent agenda starting at items 9. Communication items 9.1. Do I have consent? And if I don't hear from you, I will assume I have consent. So, with regards to item 9.1, consent. Very good. 9.2, communication item. I have consent. 9.3. Consent. 9.4. Consent. 9.5. Consent. I have newly listed item 9.6, the Brampton matter related to the Sharps, and I believe Mayor Brown will want that held.
Yes, please hold. It's Councillor Santos.
Very
I'm
good.
wondering if we could also talk about that during the COVID-19 update.
Very good, yes. So 9.6 is being held, very good. Staff presentation, nothing under human services. On to item 12, communications 12.1. Do I have consent? Consent. 13, items related to planning and growth management, external legal services for regional council. Do I have consent?
Please hold.
Please,
Oh,
Karen
okay.
Rice.
Asked to be held. 13.1 to be held. Item 15, items related to enterprise programs and services. 15.1. I have consent. 15.2. On consent. 15.3. On consent, then we have communications, item related to public works, none, nothing related to health. Other business, we do note 21.1, summary note, response to the Ontario Poverty Reduction Consultation. Do I have consent?
Please hold. I just have a question on that. It's Councillor Santos.
Very good. 21.1 to be held. Councillor Parrish, I acknowledge 21.2 at this time as your inquiry on the CAO matter, so that is to be held as per Councillor Parrish. On to the bylaws and in camera. Perhaps I will deal with the in camera just to see where that might take us in advance. Item 21.1, the April 23rd closed session report. On consent, 24.2, expropriation proceedings, Mayfield Road and Chingakuzi. Do I have consent? And item 24.3, the appointment of a temporary associate medical officer of health.
Councillor Sato, please hold.
Very good, and that will be held in the in-camera. Okay, with that, Madam Clerk, I come back to you to be clear on what matters are being held in consent and what is being dealt with, and your vote.
The matters being held are all of the items under 8 and 9.6, all COVID-related. Item 13.1 is held, 21.1, 21.2, and 24.3 are all being held. I'll call the vote for the consent. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
I support.
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini? Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes? Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi? Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. Carries. Thank you.
Thank you very much. That deals with the consent agenda, and it brings us down to item 8, COVID-19 related matters. If I may, please allow me to start out on a very happy note, I would think. Councillor Mahoney was kind enough to reach out to me and reminded me, as many of you have, that we've had so much praise for our frontline workers, the nurses, the medical workers, et cetera, et cetera. And he acknowledged that a big shout out should also go to our volunteers that are helping in this cause as well. And I certainly don't want them overlooked, but I must tell you as well, during our regular 5 o'clock conference call with all the mayors too have been effusive in their praise of the volunteers and all the things they have done as well. But thanks to Councillor Mahoney for reminding us that we do want to acknowledge the volunteers as well. And at his request, I'm glad to add that emphasis to this morning's meeting. With that, item 8.1, COVID-19 pandemic update, the path forward. Presentation from Nancy Polzanelli, Interim Chief Administrative Officer. Nancy.
Good morning, Chair Yanika and members of Council. We all know that the impacts of COVID-19 have been far-reaching in our personal lives, in our Peel community, within our province and country, and indeed globally. Our regional response over the last 2 months has been grounded in the advice of our Peel public health experts, guided by key provincial directions, aligned with our local municipalities and integrated with our broader community partners. As a result, we are making steady progress in the fight against this virus. There will be no specific date to mark the ending of the pandemic response and the beginning of the new reality of a post-pandemic world. But the region is moving towards that future one step at a time. Next slide. We continue to see new COVID cases in Peel and across the GTA, which demonstrates that we are not out of the woods yet. However, over the past few weeks, we have seen the success of our efforts and evidence that we are slowly flattening the epidemic curve. In response, the province announced a framework for reopening business, which has triggered great conversation about recovery across both the private and public sectors. As we plan towards a new normal, I remain cautious about the road ahead and the need to continue with evidence-based decision-making. Working with the support of our Medical Officer of Health, we remain committed to the region's emergency measures and will adjust accordingly when the time is right. And when we do adjust, we will do so in a way that leverages the lessons learned over the past 9 weeks, while we maintained business continuity for our many programs and services. Next slide. This slide specifically speaks to our regional process that has been facilitated by the Regional Emergency Operations Center, created to coordinate an organization-wide response. Key components are listed under these 3 buckets: corporate response, community collaboration and innovation, and task force. For the past 8 weeks, the CAO updates to Council have articulated details of this work in each of these 3 areas. Corporate response speaks to internal initiatives that allowed us to prioritize essential services and enable critical work to continue and expand across the organization safely, effectively, based on needs, and with the principle of equity top of mind. Our staff redeployment and centrally managed inventory programs are 2 such examples. Community collaboration and innovation is grounded in our broader vision of Community for Life and is connected to the important role that the region plays in protecting those most vulnerable in our community. This work has been multi-sectorial, community-focused, and has expanded on our existing good relationships and network of close partners. And of course, examples here include the Community Response Table and our Homelessness Prevention, Isolation, and Recovery Program. Finally, I want to acknowledge several task forces that were established early in this emergency to strategically address specific areas, including finance, capital and construction recovery planning, surge and isolation housing, and demobilization and recovery. Financial management is and will continue to be a key focus as we plan for the region's new normal. Like other municipalities across the province, the financial impact to Peel is significant. Today, Norm Lum, Director of Business and Financial Planning, will provide an update on the financial impact of COVID-19 under three key areas: economics and the start of a recession, the 2020 fiscal year with an approximate $36 million forecasted deficit, and cash flow, including a potential development charge revenue shortfall of roughly $400 million over the next 2 years. Addressing this pressure will require creative solutions, difficult decisions, and advocacy to upper levels of government. Next slide. As Council is aware, on April 27th, the provincial government released the plan, a framework for reopening our province, to guide decision-making on how to reopen businesses, services, and public spaces in Ontario. We have heard Premier Ford emphasize that this document is a roadmap, not a timetable. The 3 stages of the provincial framework outline what needs to be in place before the restrictive measures can be gradually relaxed. And these include a reduction in new daily COVID-19 cases, the capacity of the health system to treat cases, as well as public health capacity to continuously test and isolate new cases. Regional planning for demobilization and recovery to a new normal will be based on provincial direction and anchored in advice from our Medical Officer of Health. And Dr. Lowe will follow my presentation and speak to the public health insights and guidance to the region's recovery. While identified separately on this slide, it is important to note that the process of demobilization and recovery are intricately intertwined. Notably, approximately 80% of regional services continued through our COVID-19 response. So moving forward, for all services, both those that continued and those being brought back online, we will maintain an eye to improvement, adaptation, and innovation to ensure the Peel community not only recovers, but rebuilds stronger and more connected. But I want to confirm, while guided by the provincial framework, the region's response will first ensure the safety and well-being of Peel residents and regional staff, so timing is fluid. Our decisions will be risk-informed, grounded in the best available evidence, and coordinated based on community need. Next slide. The region is preparing for a phased approach to this demobilization and recovery across all services, activities, and work sites. As noted on this slide, each phase will consider, and noted in the bullets, each phase will consider public health data on community transition, what emergency measures can wind up, wind down, and what services and operations can ramp up. As program areas plan their recovery, they will proceed in an informed and measured way and consider the impact in the following areas: service levels, risks from delay, finances, human resources, and most importantly, impacts to the community. Further, to ensure regional programs and services are resumed in a coordinated way across the organization, planning decisions will be reviewed through the following key areas: workforce, health and safety, digital, facilities, communications, and public health guidelines. So put simply, recovery will look within each program and across the entire organization. Next slide. The region, together with our partners, have worked to address community needs that are continuously evolving. Earlier, I highlighted some of the ways that the region is responding to COVID-19, in large part by maintaining essential services, adapting service delivery, and lending capacity to address urgent challenges. Moving forward, we will build a future state on the foundation of community health and safety. And as we ease into our recovery, we will take advantage of workplace innovation, newly designed and tested work practices, and accomplishments and efficiencies previously achieved or underway prior to COVID-19. And we will do this while managing the financial impacts during and following these unprecedented times. Further, we will continue building on the collaborations within the region and with external organizations, embedding partnerships across health and social services sectors, and enhancing relationships with all levels of government and government agencies, all of which are factors critical to achieving the region's vision of a community for life in Peel. And I look forward to keeping Council informed as we progress through this recovery. Next slide. Again, to close, I want to end by thanking and commending our regional staff and volunteers for their willingness, determination, and commitment to serving the region and residents of Peel. And thank you to all of Council for your ongoing support. At this time, the executive leadership team and I are happy to take questions.
Thank you. I have a list. Councillor Santos and Demerla. Councillor Santos.
Thank you so much through you, Chair, and thank you, Nancy, for the update. I'm wondering if I just can bring forward the correspondence of 9.6 from the City of Brampton, which was a motion passed yesterday regarding an emerging issue because of COVID-19, and that is in regards to the increase in unsafely disposed of sharps at various encampment areas as well as around the downtown during the COVID-19 pandemic. And so the motion is asking from the City of Brampton, we're asking for the region to assist us in installing receptacles in the downtown as well as in encampment areas in order to have safer disposal of those sharps during this time. If staff could comment, that would be great. And then my other question is on mental health. There's some items later on in the agenda related to COVID-19, and I'm finding that while we talk about mental health during this time of COVID-19, there hasn't been much funding that's being tied to mental health issues. So those are just my two questions. If staff can comment, that would be great.
Councillor Santos, what I'm going to suggest is I will take the second question first as it relates to mental health, because I think it's more appropriate at that time. I will double back on the first item with the sharps, because I think staff might like to speak to it, but I don't want to go down that tangent yet while we're still dealing with the main report from our CAO. So with regards to your second question about mental health, acknowledging I'll come back to the first one later, through to Nancy or whomever. Councillor Santos, you've placed your question with regards to the CAMH issues. Through to staff.
Yes, thank you for the question, and through you, Chair Yanika. Absolutely, mental health is certainly on our radar for the Peel community as well as for our own staff. There is a report coming to Council on May 28th that will speak specifically to mental health through COVID. So if you'd like, we will do that. We will complete that report and bring it back to Council and include the funding opportunities that we may pursue.
Okay, that sounds great. Thanks so much. And I'll reserve my other question about mental health for 21.1. Thank you.
Very good. And Councillor Santos has promised, after I've dealt with up to 8.9, when I deal with 8.10, the update regarding waste management, I will deal with new item 9.6 at the same time that you've raised, and I think we'll get an oral update and we will deal with that accordingly at that time. Next on my list was Councillor Demerla, but I don't see her on my list at this time, but I still want to acknowledge her. Councillor Demerla, did you still wish to speak on the original presentation?
No, it was just a hangover from the last time.
Very good, and I'll acknowledge you later with regards to your other item. Carrying on with my list, Councillor Sinclair.
Yes, thank you. I was interested in the last bullet point on the slide titled Going Forward, which talked about building from innovations and lessons learned. And I wondered if there's a role here, a longer term role for the Emergency Management Program Committee to prepare a review of the entire experience of the region in this COVID-19 pandemic. And I noticed, for example, the purchasing and trying to access protective equipment and masks and various other accesses. So I just wondered if anyone had considered doing that during one of the discussions of the Emergency Management Committee. There was discussions of an evacuation effort for forest fires in northern Ontario and the lessons learned from that. So I think there's a bit of a precedent there. So that's just an idea that's occurred to me, that information could be gathered for a future learning report under emergency management. That's it, sir. Thank you.
Thank you. Unless staff has a quick comment, that's something to come back when we sort of do our post-analysis of how we can do better come, God forbid, the next crisis. Councillor Sado.
Yes, thank you, Mr. Chair. On slide, the phased approach, slide, it doesn't have a number, slide 5. I do have a question. We have been extremely careful at the city, and so has the province, of really stressing that it's a plan, not a calendar. And I guess I was a little surprised to see some timelines in the recovery phase, Nancy. I think a resident looking at this who, or a business person, is basically going to see phase 1, spring and summer. So this is going to happen spring and summer. Then when they look further ahead, okay, now we're looking summer, fall, and I'm not as worried about fall and beyond, because hopefully it will be at least fall when we get the limited transmission and everything else. But I guess I want to throw it out as a concern that this may be unrealistic to have set some timelines, which we're all in our other roles, we are really trying to avoid, because you always know that someone is going to come back and say, well, yeah, but you said this would happen at this period of time. So could you just clarify that? Like, I really have a concern with that.
Yes, thank you for the question, Councillor Sado, and through the chair, you are absolutely right. The one thing we know is that timing is fluid. So what we've done here is really, it's guidance. It's guidance to put framing around to create a framework. But what we do know is that our path forward will continue to be assessed based on the advice of our medical officer of health and the need of the community. So while on the screen it says phase 1 may be spring, summer, if it takes us into the fall, then so be it. So we are very cognizant that while we are using the provincial guidelines as a framework, that the actual timeline will be dependent on the COVID response, our advice from our medical officer of health, and the need of the community. So there's a number of elements being balanced, and that's why we actually haven't put dates or months on the screen, because we do know that it is we're in a fluid reality. So absolutely, we take point.
But the point is, you have put dates on the screen, and that's my concern. If it just said phase 1 short term, mid-term, long term, and didn't have that line below it, I wouldn't have a concern. But basically, you have put dates. You have said spring, summer. That means June, July, August. So, you didn't put specific dates, but you kind of did. And I do have a concern with that. There's no disclaimer on that page that says, these dates will be subject to advice of the medical officer of health. that may be somewhere else in the presentation, but it's not on that page. And, you know, residents right now, our citizens are trying to grab something that they can say, oh, look, this is where we're going to be. This is when this is going to end. This is when we're going to be doing things. And, you know, you hear that there are a lot of assumptions that are made, and I could just see people posting on Facebook, oh, the region says, you know, here it is in writing. It was public at the council meeting that spring and summer, this is what we're going to be doing. And this is what we're going to do in the fall. So, I mean, I really think that that line should be removed from whatever is made public on the region's website. And I know that this is a public document, but I really have a concern. I think it could lead to a lot of confusion, a lot of expectation, and quite frankly, a lot of concern as well as people see, you know, the words fall.
Thank you, Councillor Sato. We're happy to move that line because, in essence, the key here and the fundamental way in which we are moving forward is exactly how you would expect, and that is in a fluid manner. So we will take out that line so that there is no confusion. In addition, we'll also hear from Dr. Lowe on how that timing may go in that fluid way. So note taken. Thank you.
Could I also suggest that if possible on that slide on that particular slide, you do add that timing will be contingent, some wording that specifically relates to the fact that timing of these phases is contingent on advice from the medical officers of health. I just think it's really critical right now for clarity and communication purposes. Thank you.
Okay, thank you.
Thank you, and I have no other speakers. And Councillor Sato, thank you very much because you give me a marvelous segue into our next presenter, Dr. Lawrence Lowe, on the very topic that you've raised. And the segue you've given me on the very point that you raise, I really have to single out our three mayors, Mayor Crombie, especially yesterday in the media, Mayor Brown, Mayor Thompson, how they've gone to great pains to emphasize the point that you're making, Councillor Sato, the fact that we are in no rush whatsoever. Let the science and the medical officers of health speak to us as to what is most appropriate. And as I say, like all of you, I follow all of the media, and Bonnie Crombie yesterday, Mayor Thompson, Mayor Brown have done a marvelous job in conveying that publicly, and dare I say privately, to the decision makers at the provincial level, that there is no rush, and they share an opinion that the regional chair shares, and I think we all share. So message taken, but shout out to my three mayors for having conveyed it very, very strongly and appropriately. With that, my new list includes Mayor Thompson on the subject. Mayor Thompson.
Mayor, thank you. My question is, our economic development, similar to Brampton and Mississauga, we're looking at recovery out of helping our businesses, when we do get restarted, how to do that and reaching out to the business community. I really think it's important that we get the REOC group working with our economic development folks as well, because we need the region to be part of the solution here going forward.
Mayor, I think that's agreed all around, and thank you. Okay, with that, I go on to my next presentation, 8.2. As announced, Dr. Lawrence Lowe, Interim Medical Officer of Health, and Greg Kubjija, Advisor, Infection Prevention and Surveillance, Office of the Medical Officer of Health, to give us their latest update. And Councillor Fonseca, I put you on notice that after those two full presentations, I will be acknowledging you on the point you raised on behalf of FCM first. Dr. Lowe.
Good morning, Mr. Chair and members of Council. It's a pleasure to be able to address you this morning together with Greg Kubjija, our advisor in Peel Public Health, who has done a lot of thinking around the planning for the next phase of the COVID-19 pandemic. I'll provide a bit of comments as preamble, and then I'll give it to Greg to give you the details. When we first took our steps together in mid-March, COVID-19 had just gotten a foothold in our community. It didn't seem like it then, but the decisions taken then were the easy part. Really, what we did was we closed so we could reduce interactions and thus reduce the risk of spread in our community. We knew that closure was always going to be a temporary measure. We simply needed to get the virus under control, and our aim was to forge a path that balanced the impact of the closures over a long period with the risk of COVID-19 overwhelming our healthcare system in the short term. To be sure, the passage of the virus through our senior settings here and elsewhere in Canada has been hard to bear. However, we have, to some extent, averted the worst scenario in our community. And that brings us to reopening. Now, reopening was always going to be the hard part, because it isn't a matter of just saying, as you were, especially with COVID-19 still lurking in the shadows, which is why it's important to do this right. We know that everyone wants a timeline out of this. The reality is that setting a firm timeline is like saying that there's 2 minutes left in the fourth quarter of the Super Bowl. We could let up after 2 actual minutes, but COVID-19 would maul us. So in making decisions, we need to move away from talking about timelines and to start talking about thresholds. Provincial framework provides some guidance on stages and themes, and Peel Public Health continues to examine and discuss with other health units how these translate the provincial framework into practice in our region, so that we can better advise you as council around the ideal time to decide on lifting restrictions in our region. We continue to do this while also examining our other critical public health services that will also need to ramp up as things reopen, such as inspections, clinical services, and infant programs. The timelines do matter in one specific instance, which is when decisions to change are made. Council will recall that it takes 2 weeks, roughly, for this virus to incubate, and 2 weeks for a mild illness to run its course. That means, if you're going to reopen things, you shouldn't be making decisions day by day. You should make all the changes you want to make at once, and then wait at least 2 weeks to see the potential impact of those on new cases and severity to decide whether you want to hold or move ahead with further loosening. So I will state simply ahead of Greg's presentation, Peel Public Health continues to broaden testing and continues to manage cases and contacts. We continue to find new cases in the community, and though they are slowing, thankfully, we continue to see severity in our hospitals, though this is slowly improving. On its face, though, that picture suggests that we must proceed with caution, and we share this picture with other health units in populous areas in the Greater Toronto Area and also Ottawa. So given all this, I recommend that any thresholds or decisions around reopening should ultimately account for the specific picture in our more populous, highly interconnected urban region. I will now pass it over to Greg Kabija, our advisor, to share some specifics on how we are adapting the provincial framework to open here in the region of Peel. Greg?
Thank you, Dr. Lowe. Good morning. Thank you for the opportunity to present to Regional Council today. My name is Greg Kabita, and I'm an advisor with the Office of the Medical Officer of Health at Peel Public Health. We're at a critical juncture in the COVID-19 pandemic because of the challenge of minimizing economic and societal disruption while continuing to protect the health of the population. Next slide, please. On April 27th, the Government of Ontario released a framework for reopening our province. It outlined the criteria Ontario's Chief Medical Officer of Health and health experts will use to advise the government on the loosening of emergency measures, as well as guiding principles for the safe, gradual reopening of businesses, services, and public spaces. The image on the slide outlines the restart phase of the province's plan. Phase 2 is broken up into 3 different stages. In each stage, a different set of workplaces and outdoor spaces would be allowed to reopen, and restrictions on public gatherings would be relaxed. Public health officials will carefully monitor each stage for 2 to 4 weeks as they assess the evolution of the COVID-19 outbreak to determine if it is necessary to change course to maintain public health. Across all 3 stages, there would be continued protections for vulnerable populations, such as residents of long-term care homes, homeless shelters, and other congregate living settings. Additionally, we would see the continued practice of physical distancing, hand washing, respiratory hygiene, and significant mitigation plans in place to limit health risks in the settings that reopen. Next slide, please. Since COVID-19 was made a reportable disease on January 24th, a number of public health measures have been implemented, primarily in the form of emergency orders. The emergency orders largely aim to decrease the amount of contact between people in order to reduce the risk of COVID-19 transmission. The measures that are starred have had the most significant impact on the day-to-day lives of Ontarians. These include the closure of public schools on March 12th, closure of non-essential workplaces on March 23rd, and the prohibition of gatherings greater than 5 people on March 25th. Not captured on the timeline, but also critically important, was the significant reduction in elective surgeries and other non-emergent activities. The Ontario health system started this on March 15th in order to create capacity to care effectively for patients with COVID-19. Next slide, please. Before significantly easing the public health measures that are currently in place, it's critical that at the provincial and local level, a set of criteria are met. Within the Ontario Framework for Reopening, the criteria fall into 4 broad domains. The first is virus spread and containment. Are we seeing consistent decreases in the number of new cases in hospitals, and cases that can't be traced to a source? The second is health system capacity. Is there sufficient acute and critical care capacity, access to ventilators, and ongoing availability of personal protective equipment? The third is public health system capacity. Can we reach newly reported cases and their contacts quickly to break chains of transmission? This is the critical work of my colleagues at Peel Public Health, who have been conducting case and contact management since Peel's first case was reported on March 5th. Lastly is incidence tracking capacity. Is there sufficient laboratory testing to ensure a resurgence in cases is identified quickly? Not only should the criteria and their associated indicators be monitored to support initial easing of public health measures, they also must be closely monitored for the duration of the pandemic to ensure future actions are supported by data in the local context. Next slide, please. As you know, the province started to allow certain businesses and workplaces to reopen effective May 4th, as long as they comply with strict public health measures and operate safely during the COVID-19 outbreak. The initial set of businesses included garden centers and nurseries for curbside pickup or delivery, lawn care and landscaping businesses, additional essential construction projects, automatic and self-serve car washes, auto dealerships by appointment, and golf courses and marinas for seasonal preparation. Other reopening announcements have occurred since then. On May 8th, garden centers and nurseries were allowed to reopen for in-store payment, and hardware and safety supply stores reopened on May 9th. This past Monday, retail stores with street entrances were allowed to reopen for curbside pickup or delivery, and we also saw the initial reopening of provincial parks and conservation reserves for day use. It's important to note that while specific business sectors have been granted permission to reopen, all of the emergency orders I mentioned on the previous slide remain in effect until at least May 19th. Next slide, please. Ontario has not experienced COVID-19 equally across the entire province. This map shows the rate of COVID-19 infection for Ontario's 34 public health units. The infection rate factors in population size to allow for more accurate comparisons between geographic areas. The darker green areas on the map represent higher infection rates. We know that transmission of COVID-19 is higher in areas with higher population density, and as you can see from the map, the Greater Toronto Area health units, Peel, Toronto, York, and Durham, all have higher COVID-19 rates than many other health units in Ontario. Other reasons for higher rates include the number of institutional settings and volume of essential businesses. The important point to remember is that Peel's and other GTA health units' experience of COVID-19 has looked and continues to look quite different from other areas of the province. Developing a locally driven approach based on the provincial framework will be critically important as we begin to move towards a new phase in the pandemic. We are actively working with other health units in the GTHA to ensure that a consistent set of indicators are being monitored, which will guide future recommendations. Next slide, please. This graph shows us the number of COVID-19 cases in Peel by day. The light gray bars represent community cases, and the dark gray bars represent institutional outbreak-associated cases among residents and patients. These are cases among our long-term care homes, retirement homes, and hospitals. You can see that our curve peaked in mid-April. However, since then, Peel's number of daily cases has remained fairly stable. This demonstrates that we still need to continue measures, including physical distancing. Given some people don't develop symptoms of COVID-19 for 1 to 2 weeks after being exposed, the bars in the last 14 days of this graph remain subject to change. Though the number of newly reported cases associated with outbreaks in institutions has slowed, due to the vulnerable nature of many individuals in these settings, we continue to support this population. Next slide, please. At the April 23rd Council meeting, we presented you with modeling data that helped paint the picture for what the long and short-term outlook of the COVID-19 pandemic might look like for Peel and Ontario. Since that presentation, the Ontario modelers we've worked with have provided us with new data which illustrates the critical importance of us not reopening too quickly. The widespread, effective physical distancing measures currently in place have helped us keep below the health system capacity threshold. This is what they are designed to do. However, a high proportion of the population remains susceptible to the virus that causes COVID-19. The new modeling work highlights that we will see a resurgence of transmission and an amplified second wave of cases without careful planning and expanded public health system, and testing capacities as we begin to reopen. Next slide, please. The two figures on this slide will help to illustrate the risk of reopening too fast. The figure on the left shows cases in ICU. The figure on the right shows cumulative or total deaths. With the physical distancing measures currently in place, it's estimated that overall we have seen a 70% reduction in contacts between people compared to our old normal. If we were to continue along this path, you can see that we stay on the bottom line of both graphs, the lowest number of cases in the ICU and the lowest number of cumulative deaths. Unfortunately, the degree of economic and societal disruption that comes from this degree of physical distancing is not sustainable in the long term. On the other end of the spectrum, if we were to go completely back to our old normal all at once, a 0% reduction in contacts relative to normal, you can see that by mid-June, we'd start to see quite dangerous increases that would likely overwhelm our health system capacity. Finding the optimal balance between reintroducing some amount of contact between people while ensuring we remain below the health system capacity threshold will require slow but deliberate action and very close monitoring. Next slide, please. As presented on April 23rd, we don't know exactly what the period between now and a vaccine will look like. There remain a number of important unknowns about the virus that causes COVID-19, including the degree of seasonality it will exhibit and the degree and duration of immunity following infection. As our scientific understanding of COVID-19 continues to increase, so too will our ability to forecast future scenarios. Based on previous pandemics, a set of 3 simplified scenarios can help illustrate what our future might look like. On the top is a scenario of peaks and valleys, essentially rolling periods of increased activity followed by lulls in activity. The middle is a scenario of a fall peak or an amplified second wave. Reopening too quickly, as the modeling work we presented in the previous slide shows, could set us up for this risk. The bottom scenario is what the authors called a slow burn. There would be fairly consistent level of community transmission, but never reaching the intensity of our first wave. Next slide, please. As Ontario starts to reopen, some considerations that may be taken into account include differential COVID-19 transmission risk across different sectors and settings. One way to think about setting-specific risk is to break it up into 3 distinct but related concepts. First is contact intensity. What type of contact between people, either close or distant, and what duration of contact between people is common in the setting. To illustrate 2 different ends of the contact intensity spectrum, think of attending a sold-out concert versus picking up takeout from a restaurant. Second is number of contacts. What is the average number of people in the setting at one time? And lastly is modification potential. To what degree can activities in the setting be modified to reduce risk? Next slide, please. Helping to reduce setting-specific risk are the numerous mitigation measures, many of which we're already familiar with, that will become part of our new normal for the foreseeable future. Mitigation measures can be thought of in different categories. Engineering controls aim to remove or block the hazard at the source. This includes things like physical distancing, physical barriers between people, and environmental cleaning and disinfection. Our second set of options are administrative controls. These aim to optimize movement of people to minimize potential contact with the hazard. Many of these are currently being used across multiple sectors, and they include things like working from home, virtual meetings, and temperature or symptom screening. Our third set of options are personal hygiene controls. These include individual actions or behaviors that might reduce hazard exposure. These are behaviors we recommend during every respiratory season, including hand hygiene and respiratory etiquette, and also include wearing a non-medical mask for source control, which aims to protect others if the person wearing the mask was infected but in their pre-symptomatic phase. Our final set of options is personal protective equipment. This option is both risk and setting specific. Our challenge over the coming months and potentially years is to continue to appropriately pair public health measures with our current situation to ensure our health system capacity threshold is never exceeded between now and the time where we have a widely available vaccine. Thank you for listening. Dr. Lowe and I would be happy to take any questions.
Thank you. Councillor Fonseca, as promised, now that we've had the two presentation, this might be the perfect time for you to give you FCM update. Councillor Fonseca.
Thank you very much, Chair. And yes, this timing, I think, is very appropriate. So thank you very much for allowing me to speak to this announcement made by FCM this week, as it is in alignment with all of us right across the country as we move forward into this next phase of dealing with COVID. And in all of the challenges that we are facing, this is a bit of good news and a little bit of a silver lining, and an illustration of how local government is working in conjunction right across the country with different organizations and other orders of government to support one another through the virus. So this week, FCM announced the COVID-19 Community Response Fund for Vulnerable Populations initiative, and it is a collaboration with the Canadian Medical Association Foundation, and will help municipalities across the country support frontline workers and services during the pandemic. This is an unprecedented contribution from the Canadian Medical Association Foundation of $10 million, and it is meant to empower municipalities and to help them and to complement other programs that they have already put in place to directly support vulnerable populations struggling with the impacts of the COVID-19 pandemic. I'm very pleased to announce that Peel is one of 70 of the recipients. And Mr. Chair, you will be receiving, if you have not already, a letter from FCM and the Canadian Medical Association Foundation with details around this distribution of the funds from this initiative. I know that it is not right now the appropriate time because we don't have the details, but at the appropriate time, we could, once you have received the letter, and I'm not sure through the clerks if this would be direction, we send a letter of thank you, but also have in a report how the funds could potentially be distributed. That would be wonderful. I do want to say that the Federation of Canadian Municipalities, in conjunction with the Canadian Medical Association Foundation, they specifically set this this fund up with no criteria, no specific criteria. As I noted, it is meant to empower the municipalities to ensure that funds are getting specifically to those in need in vulnerable, locally vulnerable situations. And they've given that empowerment through the fund to the local municipalities to best invest these funds where needed. And the reason why they have been able to do that is because through FCM, all the work of FCM members, and also ongoing communication and collaboration with organizations like the Canadian Medical Association Foundation, and through committees, the FCM has been able to set up programs pre-COVID to try to address or to help address and support the most vulnerable populations right across the country. The one committee that I have had the honor and pleasure to sit on, along with Councillor Dillon, is the Social and Economic Development Committee at FCM. And I do want to thank all of those committee members, including Councillor Dillon, for the many, many times that we have discussed the importance of having supports and services delivered directly to local municipalities to address housing, homelessness, and wraparound supports for vulnerable populations. One of the examples is Reaching Home, which Peel has been a recipient of, and also through to the local municipalities through Mississauga, Brampton, and Caledon. And because of this, of the work that has been done on FCM's committees such as Social and Economic Development, the Canadian Medical Association Foundation has said they've listened, and they have said this type of an initiative right now in the time of COVID is a way that they can quickly flow funds through to municipalities to ensure that municipalities who are working extremely hard, and we've heard it through the presentations here today, and we've heard it from the mayors and all of the Dr. Lowe and all of Peel, who are meeting every day at 5 o'clock, and you, Chair, to try to address in the best way possible on the front lines all of us, the most vulnerable, but all of us in the region of Peel as we go through COVID. So again, I just wanted to thank you for allowing me to give this announcement on behalf of, as the regional representative, the regional Peel representative at FCM. It's a welcome and appreciated announcement. There will be more details to come through to Peel. And again, this is meant to support and to support frontline workers and to empower all of us in the region of Peel as we move forward into this next phase. It can be used towards repurposing facilities. It can be used towards provisions for food. It can be used for mental health, something that was brought up by Councillor Santos earlier. And there is no specific criteria. And the appropriate time, I guess it would be now through just direction, that once you have received the letter, that it be brought onto an agenda in the future. Thank you very much, Mr. Chair.
Thank you very much, Councillor Fonseca. Very well presented, and I think we all know, those of us that know you well, in no small measure through the many, many years you've been fighting for us at FCM. And you took the words out of my mouth and the clerk. As you were speaking, we agreed that as soon as the letter is available to us, it will be on our next proper agenda. The details will be before us, and you'll guide us accordingly. And we'll take that opportunity to thank you again in the FCM. So mission accomplished. It will be on our next formal agenda as soon as the correspondence reaches the chair. And again, thank you for your efforts and to the FCM as well. Okay, moving on. My list of questioners. Councillor Demerla.
Thank you, Chair. Can you hear me?
Yes, I can. Please proceed, Deepika.
Thank you. My questions are, I guess, to Dr. Lowe. One of the, I do understand the need for different areas of Ontario to have somewhat different timelines when it comes to recovery. My only question was, and I'm sure you've thought about it, but I wanted some clarity, is that since we are so interlinked in the GTA, if we were to, I assume that the region of Peel would have to be in lockstep with the rest of the GTHA, because if we don't open and Toronto opens or Brampton or Vaughan opens, then we just have populations from Peel going there, especially in terms of, you know, what we open and what we don't open. So I just wanted some clarity on, I see the rural-urban divide, more dense areas, less dense areas division, but I'm assuming that the region of Peel will pretty much be in lockstep with Toronto, Durham, and York. That was my first question. And I wanted some clarity around the masks, because I know we've been told repeatedly that wearing masks only protects the other person, but doesn't protect the wearer of the mask. And I'd like to understand why that is. Why is it that if I wear a mask, I only protect somebody else, but I'm not protecting myself? Thank you.
Thank you. Through to staff.
Thank you, through the chair. Thank you, Councillor Demerla, for the question. So I'll start with the first question, and I wanted to clarify some of the remarks that I made earlier. So while we really should be talking more about thresholds in terms of reopening the community, I think it's completely reasonable for regional governments as well as health departments to be planning for those thresholds and to really be looking forward to figuring out what are the steps that we would want to take as we start to see those indicators and those pieces improve. And so, certainly as CAO Polsinelli identified, the region of Peel, together with Peel Public Health, is proactively planning so that we're ready to address issues as they come up once thresholds are met. And I can also share that we at Peel Public Health are also actively talking with other regions in the Greater Toronto and Hamilton area, recognizing that they do share a similar picture to our situation here in Peel in terms of the impact that COVID-19 has had on our communities and on our healthcare system. So I think the best way to answer your question is we moved into the closure together to some extent, and we will need to move out together, just recognizing, of course, that we are a highly interconnected, mobile metropolitan area. I think the other piece that I would add in responding to that question is that it's also a matter of trying to apply the provincial framework in a manner that makes sense for our local practice. And I believe Greg spoke to that in his presentation, the need for us to really be clear about what those thresholds are. So using measures such as, for example, we could say, let's look at a 14-day moving average of cases, and that should be trending downwards. That will be what we will then use as a threshold to decide, okay, have we had a decrease of a 14-day moving average of cases? Then, we can look at least over the next 2 weeks in terms of making changes, etc. So we're in the midst of discussions with all the other health units in the Greater Toronto and Hamilton area, and also Ottawa, which has actually seen a lot of these, basically a similar picture to the pandemic, to figure out how we adapt the provincial framework to our decision making and how we then determine those thresholds by which we would take action, hopefully in somewhat of a coordinated fashion that makes sense to our local context. So that answers your first question, I believe, Councillor Demerla, and then through the chair, and the second question around masks. As has been recommended, masks are useful for source control in the sense that no matter how you wear a mask, the idea that you have a face covering means that you are actually reducing the amount of respiratory droplets. When it comes to personal protection, though, it's not just about wearing a mask, it's how you wear the mask, and it's also how you take it on and off, and it's also whether the wearing of your mask may change your behavior. So the challenge that we've had in terms of recommending masks for personal protection is that we do know, at least on some good studies, that on occasion people may wear masks improperly. They may not perform appropriate hand hygiene when they're taking their masks on and off, and they may also disregard physical distancing if they have a mask, believing that the mask is protecting them. And so that's why our message has been, in terms of protecting yourself, distance is very much your friend, and I think Greg highlighted that. This disease cannot transmit if you are actually outside of that 2-meter barrier with that 2-meter radius with other people. When it comes to masks, having a face covering is great for helping to protect your germs from other people because it's there. But again, how you take it on and off and how it changes your behavior has some mixed reviews as to whether it actually provides protection. Now, that said, in the long run, trained professionals like healthcare professionals, etc., if they are meticulous about hand hygiene and how they use masks and all these other pieces, they can be used for certainly for personal protections in those settings. But I think for the public, especially if we're going to start recommending masks more widely, what we would need the public to do if they want to protect themselves is make sure that they are respecting physical distancing, still performing meticulous hand hygiene when they're taking masks on and off, and making sure that they're wearing masks properly, which doesn't necessarily happen all the time right now. And so that's why the recommendation is based more on source control as opposed to personal protection. That said, in wrapping up my answer, we do actually recommend the use of masks, however, for that source control in settings where physical distancing cannot be maintained, and that's in places like grocery stores, drugstores, where the aisles might be tight. I myself wear a mask when I'm out grocery shopping, and certainly in other tight spaces, perhaps like on buses, like transit, etc., where, again, you cannot maintain physical distancing, then a mask helps us to slow spread by preventing transmission at the source. So thank you, Councillor, and I'll pass it back to you, Mr. Chair.
Thank you. And Councillor Demiro, did you have a follow-up?
I did. So two follow-ups. So what my takeaway on the masks then, Dr. Lawrence, is that if it's worn properly, it will protect the wearer as well, but there's a lot around how you wear it properly, and that's key, so I get that. The only other follow-up question was, are we able to define those thresholds a little bit more granular? I know you're saying 2 weeks of reduced or declining infections, but I saw, for example, in New Zealand, they said if the infection rate, I guess, drops below 1, so less than 1, I guess, one person infecting another person. Can we have, are we looking at something that's a little more, I guess, specific in terms of the thresholds?
Yes, so through the chair, and thank you, Councillor Demerla, for the question. Absolutely, this is an ongoing discussion amongst the Greater Toronto and Hamilton area health units and other health units throughout the province that I've mentioned. We are really keen to sort of take the provincial framework and adapt it to our local practice to come up with specific indicators. And I would say, in terms of the indicators, we're looking at things like the effective reproductive number that they have in New Zealand. We're looking at other indicators, recognizing that we will hopefully define some under the 4 themes that the provincial framework provides us, and then continue to monitor those changing indicators as we feel they serve the purposes of the time for drawing the picture. Ideally not as much, ideally trying to stick to the indicators as much as possible that we do select, but making sure that we're choosing things that we can actually measure and report on that are that provide a little bit more specificity for our local situation and builds on the provincial framework. So those discussions are actively underway, and we are hopeful to be able to release something together with our colleague health units in the coming days.
Well, that's good to hear. So what I'm hearing from you is that there will be more specific targets coming, although I'm curious how that would be in the absence of widespread testing. How are we able to say right now what the infection rate is, whether it's 1.5, whether it's 1.8, based on current testing? Like, do we know where we are at? And then what that, I know you have yet to define the threshold, but do we know what the infection rate is in Peel right now, or in Ontario, whatever works?
Yeah, so through the chair, thank you, Councillor Demerla. I had a source, I believe, that said that we are under 1 in Ontario, and I think that would at this time, I think that would make sense, just given that we are starting to see a decline in the new cases. The specific number I was told was 0.66 for the province, but I would have to double check, and certainly I can update the mayors at the 5 o'clock call as to a specific number. We don't actually have that calculation for the region of Peel, and we do recognize that any provincial calculation of that effective reproductive number would be an average across all of the health regions in Ontario, which may pose challenges, particularly if the effective reproductive number may be drawn up by health units that have been more heavily impacted. So it's a great question. I understand that overall for the province we're under 1. I believe 0.66 is the number that I've been told previously, but I can confirm that with the mayors later, either today or tomorrow at the 5 o'clock call. And it is certainly one of those numbers that we are actively looking at as one of those indicators to guide us through the various thresholds and decisions in the days and weeks to come.
Thank you so much. I just hope we can get a number for the GTHA as well. But thank you. This has been very useful. Thank you again for everything that you do.
Thank you, Councillor.
Thank you, Councillor. Thank you. And Councillor Demerla, I'm going to carry on with my list on these two main items, the two main but then at the end, it might be logical for me to deal with your long-term care question while I've got Dr. Lowe and while I've got Greg here and Nancy on the file. But first, I'll go on with my list. Then I'm giving you a heads up that I'll come back for your other inquiry. My list goes on. Councillor Dasco, Councillor Fonseca. Councillor Dasco.
Thank you. And through the chair, I just wanted to ask Dr. Lowe, when it comes to the plan for reopening, this has come to me from a local business that has taken great pains to put out a roadmap that they have for their reopening. They happen to be a gym, a local gym, and they've put together a comprehensive plan for reopening in terms of distancing, cleanliness, etc., and communication plan with their clientele. Is there any preference that you know of that would be given to somebody like this that we could direct them towards?
So thank you for the question, Councillor Dasco, through the chair. If I may clarify, so a preference meaning to the opening of certain sectors or the opening of certain businesses, is that what I think the question is?
Yeah, I think what they're looking for is under certain sectors, if there's any preferences that would be given to specific businesses once we get to that.
Great, thank you. Thank you very much for the clarification, Councillor. And so through the chair, I'm not aware at this point in time of the various sectors that are being considered at the provincial level. And certainly I would say really the specifics of different sectors as they open are, we in public health would be happy to comment on just sort of specifics within sectors and all those other pieces that may be considered for reopening. But I think the more important message that we have is just the decisions can be taken and decisions should be taken by yourselves as council, by our provincial elected representatives as to which sectors might open. But it should be done in a manner that respects at least the indicators that are developed, and those are coming, as I mentioned. And then really the timeline after opening to see if it actually has an impact. So I guess what I'm trying to say is it's less important which sectors are actually prioritized through the reopening, though certain sectors will lend themselves more easily to the measures that Greg mentioned in his presentation around physical distancing and hygiene and all those other pieces. And then also I understand that governments will need to weigh all the other pieces around economic impacts, social needs, etc., as to why certain sectors may open or not. But from my perspective in public health, it really should be an idea of the reopenings happen. We wait the 2 weeks to see what happens, and then we basically check the indicators and say, all right, did that have an impact? Do we need to, dial things back or hold or move forward? And really leaving the specifics around the openings, we can comment, but really allowing government to lead, at least in that respect. So I think I don't know if that answers your question, but I think our focus would be to just say, yeah, now it's time to start reopening stuff, and here are some ideas as to what you might reopen. But I think the ultimate decision will be left to all of you as our elected representatives.
Yeah, I guess the point of clarification I just wanted there was when, having a framework and having these things put into place, I think what they were looking for is just having details. Would there be any priority given to those folks that have detailed plans in place?
Yeah, so no, thank you, Councillor Dasco. And through the chair, I would respond just as I said in my previous comment, in my previous response to Councillor Demerla. The Region Appeal is actively looking at this. Every health department is looking at this. I think proactive planning, regardless of where you are, is certainly something that should be prioritized. I don't necessarily think they would give priority to different businesses that have a plan in place, but the strong recommendation is that people should have a plan in place for reopening, and they should be preparing for if their turn comes, they need to figure out how they're going to make sure they're operating in a way that continues to limit the possibility of transmission amongst their patrons and also protects their staff. So I would recommend, and there are I should say while I'm speaking to this, there are guidance, sector-specific guidance that is available on the Ontario.ca website. If you type in COVID-19 workplace guidance, it actually will come up with a web page that is. That's actually the webpage is called Resources to Prevent COVID-19 in the Workplace, and there is a lot of sector-specific guidance on that webpage for every sector and business to really start taking those steps to prepare for the next phase in the pandemic and reopening and their operations. So I mean, the answer is it may not necessarily lead to a specific priority, but it's something that I think everyone should be proactively preparing for.
Yeah, thanks. That's a perfect answer. Thank you.
Thank you, Councillor. Thank you, Councillor Dasco, and I'll reiterate again, you're acting like a mayor because it's the regular conversation comes up with the three mayors at 5 o'clock, in that two things seem to happen. Number one, what exactly is the roadmap from the province and what exactly does it mean? So just yesterday we learned, if the province have to step in and run in and manage the long-term care facilities, we'll do that. And yesterday we spent a great deal of time saying, what exactly does that mean? And as I say, the mayors have been emphatic in being clear, and the chair, that we need a roadmap from the province that is very clear and explicit in terms of how the florist shop and the fitness studio deals with it. And I think some of us are waiting with bated breath today to hear what comes out of the Premier's mouth, but it's got to be very clear and direct, and you're sharing the concern that we all share, and good on you for bringing it up on behalf of your constituents. Councillor Fonseca.
Thank you, Chair. Yes, just really briefly, this is a question for Dr. Lowe. Thank you very much for the presentation. Just to your point about the 2 weeks, you put something in place and then monitor, and also trying to be proactive. We, in this phase, and I know a lot of it has to do with obviously the reopening and the roadmap that will be announced by the Premier. But with regards to Peel and numbers and indications, obviously in the initial phase of the virus, it's impacted seniors, long-term care. In this next phase, has there been any discussion with regards to children and youth, and discussion into putting control in collaboration with Peel Public Health and the school boards on next phases of on this phase of COVID. It may be too early to look at that, and I know we are waiting for what the province has to say. But in this reopening phase into the summer and then into the fall, at some point eventually, this younger population, which we don't have the same amount of, it doesn't look as though we have the same amount of data on, and they have not been tested because they have not gone through, they don't meet the criteria. Has that been a discussion, and how best to prepare for that?
So through the chair, thank you, Councillor Fonseca, for the question. It's a very timely question because actually our weekly epidemiologic update, which is coming out tomorrow evening, will actually have, as you know, I think the last week the focus in the in-depth was on household transmission, and actually on this week it's on COVID-19 in children and what we understand about outcomes in children in our region. So that will, the epidemiologic update will be issued tomorrow. There will be detailed figures on that, but in general, specific to what we have seen, though, we've had about 20 cases of people under the age of 18 who have had COVID-19. Only one of them has been hospitalized, and in general, many of them, and the broader evidence suggests that there's largely more mild presentations in that age group. And I've just been advised actually that it's actually 84, not 20 cases. I apologize. I think I was had the age of under 20 under us, but we've had 84 cases. But I know that in general, at least in our region, we haven't seen the severe complications in children that have been seen in other parts of North America, such as in New York and in Quebec, with Kawasaki's disease and toxic shock syndrome. But it is certainly something that we are keeping our eye on. It's something that we are really trying to understand and weigh into any discussions around any considerations around our recommendations when it comes to reopening schools and younger settings. And so I think the big thing is, for us at least at Peel Public Health, we continue to monitor the evidence and the data around this age group, and certainly stay in touch with our our school board partners in waiting for direction from the province to really figure out if there is something that changes around those settings, how we go ahead and making sure that we're also moving in a gradual, considered fashion that also respects the risk and the evidence that may exist. So. It's a good question, Councillor Fonseca, and certainly a lot of evidence that is emerging that we are keeping a very close eye on.
Thank you very much.
Thank you. Councillor Raz.
Thank you very much, Mr. Chair, and thank you for the presentation, Dr. Lowe. I think we had a good conversation yesterday at the City of Mississauga. Certainly, people are starting to get antsy. They're seeing most of the cases. They feel like they're detached from this whole pandemic, and they're stuck. So, they want to see the parks open. They want to see things open up soon. And I guess when it comes to the communications for the next steps, we need to start preconditioning people now. So we've nailed down the messages about the social distancing. We need to start looking into that next phase of messaging about what they need to do once it starts opening up, and we need to start to get them into those habits now of masks, continued hand washing, and whatnot. I guess the other challenge we face are all the Google epidemiologists. So now everybody knows everything about pandemics. So I'm likely to defer to the experts on this. But we also need to figure out how we can manage risk. And if we keep with our numbers low and we keep people cooped up for too long, we're going to face an increasing backlash. So there's that. The other question I had is, if the province says that certain types of businesses can open, and I know they were ruminating about golf courses and other areas the other day, does the individual municipalities have the ability to say we're not going to allow those openings, or does the province take the lead on the business aspect?
So thank you, Councillor Raz, for the question. Through the chair, There. In terms of the next phase messaging, we've actually already started to roll that out, and you're absolutely correct that we've finally got things very clear on the physical distancing, the idea that distance is your friend. Certainly, I agree with you, adding the pieces around a mask where you can't physically distance and also washing one's hands. And the other thing that we've been really trying to drive home as well is no crowds, no congregating, no crowds, because crowds are really where this virus thrives. You have all these super spreading events where one person didn't know they have symptoms, they go to this even in South Korea, I think you may have heard, there was one person who went out to 5 nightclubs in one night just celebrating their newfound freedom and basically spread it to over 100 people in Seoul. So basically that it really speaks to just the idea of no crowds, physical distancing, masks, hygiene, and then also having employers and workplaces do their part to limit occupants, limit hours, put measures in place, etc. So that next phase of messaging has started, and it's something that at least for us in Peel Public Health will continue to roll out through our various channels. And certainly welcome the support of all of Council in making sure that it's clear, sort of, at least for the time being, until there's a vaccine or a cure, that this is kind of the new way that we're going to have to be limiting our risk at this time. So that's, I hope that answers the question around the next phase messaging. In respect to the other question around the decision not to open, so certainly, I mean, I think the province will come out and say these. My understanding is the province is coming out and saying these can open, but ultimately the decision to open would still rest with the operator. I don't think you would be mandated to open something that you didn't necessarily want to open per se. Certainly, there would be just balancing, as you mentioned, sort of the public's perception, especially just given how long things have gone. But it's important to remind the public, especially that if you are taking a decision not to open something, it's because things aren't back to normal yet. It's that we are still trying to really, despite the fact that it has been a slog, and despite the fact that it has been quite some time, we're not out of the woods yet. There is still a fire that is burning. It's just under control, and so I think it would be more of a messaging challenge as opposed to an operator decision, as opposed to a mandate to reopen. At least that would be my read of the situation. And one thing that Council may want to sort of keep on the radar as well is a lot of the current provisions actually arise from the provincial emergency order. And as you know, that has been extended to June 2nd. But the question then becomes, from our perspective, if and when the emergency order does expire, and depending on the picture and the thresholds we've determined around COVID-19 in our region, would we need to look at sort of the tools at our disposal to make sure that we are keeping our residents safe as well? So all that to say, I mean, I think the province will continue to make their announcements, and for us in the region of Peel, at least from my perspective as your interim medical officer of health, we'll continue to advise just based on the picture that we're seeing, so that you can all take the decisions that are appropriate for our residents to protect their health against COVID-19.
Okay. Thank you very much, Dr. Lowe.
Thank you. Councillor Sado.
Thank you, Mr. Chair, and thank you, Dr. Lowe. Just a couple of questions. Actually, a comment first. You'd mentioned about businesses not having to open, and I think we saw this past week when garden centers, for example, and other stores were allowed to open. And I noticed that some of them chose not to open one of the major garden centers because they weren't ready and they wanted to put proper controls in place, such as requiring all customers to wear masks and providing more safety measures for their employees. So I think we can depend on many of the businesses to do the right thing. I'm frankly pleased to see many of the grocery stores, for example, now requiring people to wear masks when they go in. I think that's a growing trend. And, I guess I get frustrated when I see people complaining about it, but they also have the choice not to go there. So, I think it's a good thing. one of the issues that I raised this at our council yesterday, and I wonder if you could clarify. I think communication is very critical, and there's so much confusion over what people can do. And I know it's a provincial directive of for the gatherings of 5 people, etc. But you know, this came up after Mother's Day when the premier had his daughters visit him. The medical officer of health for Ontario made a visit, I think, to his parents, his mother. But I've had residents, they think that they cannot go and visit their kids and social distance, physical distance. So can you just clarify that? Because the information that's coming from the province is quite frankly muddled, and people don't know what to do. You know, I had one resident say, well, you know, I wanted to go and visit my mother on the weekend and just go to the driveway and, you know, say hello, but I didn't want to get a ticket. So there's a lot of confusion there, if you could clarify.
Yes, thank you, Councillor Sato, for the question, and through the chair. I think the reason why the messaging it may seem a bit muddled is because the recommendations are in the process of being changed, and a lot of it is just in recognition that we are able to move gradually and slowly in sort of thinking and rethinking how our community is operating and who we're interacting with. But at the same time, we are also still not yet able to fully open the tap. So I think the way that I have been messaging this has really been the idea that these are recommendations. These are strong recommendations that are intended to protect your family, yourselves, and also slow spread and limit the transmission of COVID-19 in our community. But really, as the weather is getting nicer, it's fine to go outside, and it's fine to go, and it's always been fine to go get your exercise, and at least for sort of some of the essentials around groceries, pharmacies, etc. Anything beyond that is really up to the individual to determine, to what nature of risk they're willing to engage in. And I have neighbors in my neighborhood talking across the driveway, sitting and chatting, and sure, to some extent, you can argue whether that's essential or not essential. As I was actually told, and the mayors will recall this, I was told in no pointed terms on one of our Friday 5 o'clock calls that Mother's Day the Mother's Day visits may not necessarily be essential, but Mom very much is. So I was told never call my mom non-essential, and I don't think I had actually said that. But it really is one of those pieces where you want to be particularly careful. I think we've been messaging the idea of sticking to essential reasons and exercise for so long, but we know that people are smart about the risk and understand the importance of distancing and hygiene at this point in time. So, the answer to your question, is our recommendation still stands. Ideally, you stay close to home, you avoid crowds, you physically distance when you're out and about, and you wear a mask where you can't, and make sure you're washing your hands. And anything beyond that, it's really up to individuals to understand that it's COVID-19 is in our community, and it's a matter of how they want to approach their interactions outside of what we've recommended.
Okay, thank you. And I guess what some of the comments also included, well, I can go to a grocery store that's line up with a bunch of people that I have no idea who they are, stay 6 feet apart, go through the store, but it's being recommended that I don't drive over to to visit my kids or my parents or something else. So that's where I think the confusion comes in, and I don't think the province has really done an excellent job. I mean, they've done a really good job on communicating, but I think that is the one area that has really created the most confusion. We've been very clear: you don't go on the playgrounds, you don't go on this, you don't do this and that, but that confusion is still there.
So thank you, Councillor Sato. If I may, Mr. Chair. So This also speaks to the idea of bubbles, household bubbles, right? And I know that, for example, in New Brunswick and New Zealand, they've been talking about the idea that, you know, you start out with your bubble, and that's sort of where the broad interactions that you have been taking for the last few weeks have been unfolding. But then, as I understand it, in New Brunswick and New Zealand, they're now moving towards things like expanding your bubble so that you could sort of have multiple households within your bubble, etc. I think that is something that is being actively discussed at the provincial level. I know the Ministry of Health has a public health measures table, and really the impact to families, to social connections, etc., is also something that's being carefully looked at, because we know that besides business and the economy, this has also disrupted a lot of the, as I mentioned, this virus very much preys on the things we cherish and hold dear: our relationships, our in-person interactions, etc. So understanding when we can open that up as well is also being actively discussed and is critical. And I would also say to people who see the difference between going to a grocery store versus going to one's home, again, it was a matter of trying to draw a line as to, and again, treading on the idea of essential versus non-essential, the idea that being able to access food, medicine, gasoline, those are essential. And to some extent, a lot of our social interactions, as we've been saying, can, thanks to the help of technology, be moved into other settings online, through phone, etc., at least to maintain that while we do get this under control. So I think that's the disparity that's the difference, at least in terms of how those decisions were taken. But hopefully some more insight as to, well, I think there's two things. Hopefully more insight as to how we can start to expand our bubbles will be coming from the province. And hopefully we'll also be in a position and a threshold which may permit a bit of a loosening and broadening of the recommendation in the days to come. In the meantime, the recommendation still stands, and it's up to people to interpret it as they wish.
Okay, thank you, Councillor Sato. Just one last thought, because I think we've talked about every piece of the puzzle except one, but I've got to believe the mayors and the my colleagues are hearing this, because I'm hearing it as well. From another perspective, some of the business owners that are saying they're making every provision to have a safe workplace. They've called the appropriate health and safety people to make sure everything's in order for distancing and the sprays to sanitize and protective equipment, et cetera, et cetera. But they're running into employees that are saying, well, I really don't feel safe. And one said it to me quite candidly, between the two spouses, they've said between what the Prime Minister has promised to send us, between the Premier telling me I don't have to pay my rent, when you find a vaccine, get back to us, because we're in no hurry to go back to work. And I've had that voiced by several entrepreneurs that are trying to run a business, and I'll give him a shout out. I think his name is Howard Levitt, who's regularly on CFRB, one of the most preeminent labor lawyers in Canada, and he himself said that at the start of this, it was a lot of concern, workers, and when can we get back to work? All his calls now are from businesses saying we're having challenges getting our workers back to work, perhaps in many cases justified, because they're saying we're going to wait this out. So, boy, this thing's got a lot of moving parts. I credit my colleagues, because as the mayors again say, a patchwork solution isn't going to solve this, where one jurisdiction does one thing, one does another. And that's why we continue to need clear leadership from the province and the federal government. Okay, that exhausts this component of the presentation. So now I can appropriately turn back to Councillor Demerla, who can speak to her question that she raised, added to the agenda for long-term care. Councillor Demerla.
It's a good time. I just wanted to talk about long-term care homes, because arguably it's really the epicenter of the COVID outbreak now. And I wanted to acknowledge the amazing work that Peel Public Health has been doing, and in particular the frontline workers at our regionally run long-term care homes. And I was looking at the Peel landscape and of long-term care homes, and it's quite obvious that the regionally run long-term care homes, in terms of the outbreak, have had a much more, fortunately, much reduced incidence compared to some of the others, although I do want to say that, interestingly, some of the for-profits have done very poorly. I know of one in my own ward, which is Camilla Care, which is run by Sienna, but interestingly, and Dr. Lowe, you might have some comment or some insight. The same Sienna also runs Silverthorne Care Community, and there the outbreak right now is 0. So it's interesting how, so we have to be careful in terms of, not pigeonholing one sector versus another sector. But definitely I see that the region has done quite well, in terms of outbreak. There's still some outbreaks, but not the horrendous numbers that we've seen at some of the other care homes. And I think this speaks to, how well we run our long-term care homes, relatively speaking. And so what I wanted to suggest to staff is that the Premier has announced that he's going to do a complete overview of the long-term care sector, and he's declared this emergency, which I think has come far too late, but that's a different story. So I just wanted to know, I just wanted to say that I think it would be to our benefit to present to the province what the region has done in terms of our best practices as well, and the value we bring in how we run our long-term care homes, and to present that to the province in a way that showcases how funding, and I know a lot of the municipal long-term care homes do top-up funding, and how that top-up funding can really help with running homes in a much better way, in the way that we need in the way our seniors deserve to be treated. So just to break that down as to what we did well, how the funding is, the top-up funding that we might be doing, and how that has helped us through this pandemic. I think we really need to put that to the province as they do their overview and their overhaul of the system. We need to be ready about that. But at the same time, I also am hoping that we will be looking at what we could have done better in this pandemic as well.
Thank you. And I think, in fact, I know Commissioner Granger has some thoughts on the point that you make. Commissioner Granger?
Thank you for the question. Yes, through you, Mr. Chair. I appreciate your comments, Councillor Demirla. You're quite right that we can't paint every long-term care home private versus non-profit and municipal home in the exact same way. We participate in regular phone calls, both with our provincial colleagues and our provincial advocacy groups in terms of sharing best practices. So we are an active participants on those, and continue to discuss our infection prevention and control practices, and hopes in sharing those with others. And we also are invited to many provincial groups where we're able to highlight our good work. So we appreciate your comments. And yes, the funding and extra support that we receive through Regional Council is greatly appreciated. Certainly it helps pay our staff extra. And we continue to look for ways to enhance recruitment and enhance the number of full-time staff that we have. So we'll be continuing to advocate for that. And it's been essential in recruiting good staff and ensuring we have the staff corporately to support best practices in infection prevention and control. So thank you for those comments. We'll continue to work on that and share our best practices.
Doctor?
So, Chair, if I may, what I would really like to see, I appreciate the feedback, is perhaps some direction to staff that says that we will prepare a formal presentation for the province that very clearly outlines, where the region of Peel has been giving its, I suppose, doing top-up funding, for example, and how now the province needs to provide that funding, and any other things that the regionally run long-term care homes have been doing that has helped us cope in this pandemic and come out somewhat better than others, and put that in a paper and present that to the province in an official manner. I understand that we are collaborating and talking to all levels, but I think it's really important that we document it and present it to the province.
Agreed, and I think we're going to take...
Thank you again. Yes,
Yes, Commissioner, I'm saying we certainly agree, and to come back, we're going to take that as direction, but a final comment to you, Commissioner Granger.
Oh, yes, and we had planned a future advocacy council report on long-term care, and we'll certainly include a letter to the province. So thank you for supporting that. And thank you, Mr. Chair.
Thank you very much. Okay, with that, that exhausts my list and the questioners for presentations 8.1 and 8.2. I trust I have receipt for both, which brings me to item 8.3, update on and management of the financial impacts of COVID-19, a brief presentation by Norman Lum, Director of Business and Financial Planning. Norman.
Thank you, Chair Unica. Good morning, members of Regional Council. The purpose of my presentation is to provide highlights of the impact of the COVID-19 pandemic on key economic and financial areas for Peel and steps that are being undertaken to mitigate the financial impact to the 2020 fiscal year. Next slide, please. So as presented on April 9th by the Chief Financial Officer, the COVID-19 crisis brought to an end the longest period of economic expansion on record. And just last week, CD Howe stated that Canada has entered into a recession. The national unemployment rate had its largest monthly jump on record, reaching 7.8% in March, and is now forecast to be 9.8% for 2020. By the end of March, Peel had already seen a loss of 20,000 manufacturing jobs, and the outlook for the labor market is not positive, as more jobs are expected to be lost in the short term, including some business closures. In order to mitigate the negative impact on Peel's economy, infrastructure stimulus funding will be required to support its recovery. The next slide, please. Based on modeling of past economic recessions, it is estimated that there will be a temporary loss of $400 million in development charges over the next 2 years. In addition, due to the economic slowdown and lower interest rates, investment earnings are also expected to decline. This will have an impact on the capital reserves available to fund non-DC eligible capital work. These changes will have significant impacts to the capital program and put increased pressure on Peel's overall cash flow and financial flexibility. Over the next few slides, I will focus on the operating impact of COVID-19 on Peel's 2020 fiscal year. Next slide, please. So since the outbreak of the pandemic, there has been an impact of both the costs and revenues. The greater impact is coming from the cost side because of the nature of the frontline services that the Region of Peel provides. Based on what is understood today, there are projected increased costs of $45 million. The services that have experienced significant increased costs are the frontline services such as paramedic services, long-term care, and public health. As articulated in the report and in Appendix 1 of the report, the majority of the increased costs have been incurred for personal protective equipment, cleaning, and staffing. For housing, increased costs upwards of $10 million is forecast to be required to support the housing providers as the tenants experience increased income loss. In homelessness support, costs for the isolation and recovery centers to support Peel's vulnerable population are currently estimated to be $6 million and will likely increase. In addition to the increased costs, there's also been some loss in revenue from user fees due to the lower activity experienced in services like TransHelp, Adult Day Services, and PAMA. There's also lost revenue from the temporary waiving of community recycling center fees. Council has also made some other decisions to support the community. $1 million was initially approved to help support community agencies. To date, 71 applications have been granted for a total of $1.4 million. Slightly higher than what was written in the report. Council has also approved the property tax and water bill relief. And late yesterday, I just received an update that the ICI water consumption had decreased significantly in April, leading to an additional revenue shortfall of about $11 million. So taking into consideration all these factors, including the updated water revenue projection, a net deficit of $47.1 million is now forecast. So $11.1 million higher than the $36 million in the report. $31.6 million for tax supported programs and $15.5 million for utility rate supported programs. The next slide, please. The forecasted net deficit would be higher, but costs of $13 million have been avoided. For some services that have remained open, such as TransHelp and Affordable Transit, there have been savings due to decreased activity. For other services that had been deemed as non-essential by the province, like PAMA and Adult Day Services, there have also been some operational savings realized. A number of employment support programs, like the Summer Job Challenge and Families First program, have also been stopped. Although savings will be realized, savings were not the primary goal. The primary goal was to ensure safety through physical distancing. Costs have also been avoided by redeploying staff from non-essential services to support long-term care homes in the kitchen or laundry room or screening at the front door. And savings have also been identified by reduced discretionary spending for items such as training, conferences, and travel, and by not actively filling vacancies for non-essential roles. Next slide, please. So in addition to the costs avoided, the forecasted net deficit was also partially reduced by some specific funding announcements that directly support these services in Peel. Peel has received almost $12 million to support its most vulnerable residents, $5.85 million from the Federal Reaching Home Program, and $6 million from the Provincial Social Services Relief Fund. And as mentioned by Commissioner Granger at the April 23rd Council meeting, long-term care had received $187,500, or $37,500 for each of the 5 long-term care homes. The province still has $89 million in funding for long-term care to be allocated. Peel has also recently received letters from the province that indicate that there will be funding for direct COVID-related costs for paramedic services and public health, although no specific allocations have been mentioned yet. And no funding has been, announced yet either for housing. But as mentioned earlier in the presentation, $10 million is currently estimated as additional subsidy required for the housing providers who are receiving less rental revenue. And we do expect that there'll be new funding announcements going forward, like the $10 million that Councillor Fonseca announced today from FCM and the Canadian Medical Association Foundation. Next slide, please. So how will Peel manage the financial impacts from COVID-19? So although a deficit of $47.1 million is now forecast, subject to what will be received by the province, Peel should be able to manage the forecasted operating deficit using its rate stabilization reserves. However, this will reduce Peel's ability to deal with future new emergencies. Staff will continue to find ways to manage expenditures to help reduce the forecasted deficit. And to support the COVID response, 2 special task forces have been created. A financial task force made of existing staff to support the work of the region's Emergency Operations Center, and a capital construction task force to review and prioritize Peel's capital work to ensure the risk to its overall cash flow is managed. Next slide, please. And while we should have the financial flexibility to manage the short-term impacts of the pandemic, Peel will need additional financial supports from the federal and provincial governments over and above the measures that have already been introduced in order to fully recover. And as we come to realize the full impacts of COVID-19, we will continue to advocate to the upper levels of government to ensure that our needs are understood and considered as financial relief and stimulus measures are developed and implemented. Going forward, staff will provide monthly oral updates on the key financial areas discussed in this presentation. On the slide are the 2 recommendations for Council's consideration. Thank you, and that concludes my quick update. And I'd be happy to answer any questions that Council may have.
Thank you, and there is one, Councillor Groves.
Thank you, Mr. Chair. I don't have a question. I just wanted to move the recommendation.
Very good. Yes, very good. We got that, and you have moved the recommendation, Councillor Groves. Thank you. Seeing no other speakers, Madam Clerk, I turn it to you because I know this requires a recorded vote.
All right, Mr. Chair, I had my hand up. It's Karen.
Please go ahead, Karen.
Thank you very much. Just back to Norm's presentation, and thank you very much for the update, Norm. When it comes to advocacy, I don't think, I know that both the federal and provincial governments are in a bit of a panic mode right now, as we all are. But I think this is related to the Government Relations Committee, and I know AMO has been moved to a virtual meeting, but I think we really need to get in front of those ministers, both provincially and federally, at some point with our Government Relations Committee over the next few months, and continue with advocacy. I know that AMO and LUMCO and all of those strong advocacy groups are promoting certain agendas and ideas, but I think we as the region of Peel also need to try to get out in front of those ministers responsible that are going to be assisting us with the recovery efforts as well.
Councillor Rask, yes, I couldn't agree more, and maybe you've given me an appropriate segue. With regards to the $6 million from the province that we received, I'm thinking it's more than just coincidence, but once we were dealing with it with staff and dealing with it with our 5 o'clock meeting, et cetera, and the monies that we needed for the hospitals, were we going to need more tents, et cetera, I did manage to get a call off to the Minister of Municipal Affairs, and whether coincidence, I think in part is hard work, I think in part from Member Jones in the North, 36 hours later, the $6 million check came in. So I guess I will acknowledge the province and that the advocacy works, and a shout out to the Minister of Municipal Affairs and our local MPPs, and hope to continue on with that advocacy from all levels, which I also know the mayors are pursuing individually as well, but we will continue to do so because it's the only way we will meet with success. So thank you to you, and I will give that shout out to our friends at the province. Councillor Dasco.
Thank you, through the chair. And I just had a point of clarification I wanted with regards to Norm's presentation. That was the with regards to the DCs. Is that under the current situation, or is that factoring in what might be coming down from Bill 101?
Norm, to you.
Thank you for the.
If I may, it's Stephen Offwagen. If I can speak to that, just at a high level, Councillor Dasco, thank you through the chair for the question. What we've done is modeled and looked at past recessions and what happens to economic growth, and economic growth results in new housing units, new businesses being established in the region of Peel. Based on the 2008-2009 recession, we are currently estimating an economic slowdown that would trigger a reduction in development charge revenue over the next 2 to 3 years of anywhere in the range of $400 to $500 million. So that's it doesn't tie into Bill 108. Bill 108 presents additional challenges for the region, but this is strictly related to the economic downturn that we're experiencing, and based on what the economists are projecting for the duration of the economic downturn. Thank you.
Thanks, Stephen. Much appreciated.
Thank you. Again, seeing no other speakers on my list, Madam Clerk, over to you to conduct the vote.
Thank you. We have a motion moved by Councillor Groves and seconded by Councillor Raz that the regional chair, on behalf of Regional Council, advocate to the federal and provincial government for additional funding to offset the substantial incremental costs and loss of revenue associated with the COVID-19 pandemic. And further, that the region of Peel's advocacy efforts include a request that the federal and provincial governments provide increased infrastructure funding to stimulate Peel's economic recovery, and that an allocation model be implemented to distribute funds expeditiously. I'll now call the vote. It is after 11:30, so I understand Mayor Brown and Mayor Crombie have left the meeting. So, Councillor Carlson.
Yes.
Councillor Carlson in favor. Councillor Demerla. Councillor Demerla.
Yes.
Councillor Demerla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon. Councillor Dillon. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes.
Councillor Fortini in favor. Councillor Groves.
Yes.
Councillor Groves in favor. Councillor Innes.
Yes.
Councillor Innes in favor. Councillor Kovac.
In favor.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. I'll circle back. Councillor Dillon? Motion carries. Thank you.
Thank you. That brings us on to item 8.4, approach to the development of the 2021 budget. It's a report that's here. There's no presentation intended. Do I have any questioners or a mover? It's strictly here for receipt. So,
Mr. Chair, it's Karen Raz again.
please proceed. Go ahead, Councillor
Happy
Raz.
to move it. Questions kind of related to more 8.5, but it's related to 8.4. I was just a little bit concerned that we know that because of lack of revenue that we're not collecting from a Mississauga perspective on the MyWay, on the recreation fees. We know that the shortfall is going to be fairly significant, over 16% at this point. And I'm just wondering, with the new timelines that were suggested in 8.5, I don't see where the local municipalities fit into these timelines. I know our timelines are probably going to be pushed back at the local level, but because the local budgets are going to be so much more significantly impacted than Peel Region, we really need to work in concert with each other. And I'm just wondering if Norm or Stephen can address that.
Thank you for the question.
Go ahead, Norm.
Through the chair, we had received notification from Brampton and Mississauga that the intent at this point was to have the budget approved before the end of December, and Caledon has indicated that they won't have their budget approved until 2021.
And if I may add to Norm's comments there, and I met with my local municipal colleagues on Monday, and their observation and recognition was that with 25% of the region's budget funded by the province, there's a higher degree of uncertainty in the region's forecast relative to the local municipal forecast. So they were quite comfortable that we were waiting to hear from the province. I think one of the perspectives that I would like to comment on is, I think municipal funding coming from federal, provincial governments dealing with the direct and indirect costs associated with COVID, waiting a little bit longer may actually allow us to get a better perspective of what will be covered. It's also going to allow us, and as Norm updated council today on the water consumption drop from the ICI sector, waiting a little bit longer will actually give us a better chance to model what the degree to which the water consumption returns, which should then be positive for understanding the utility rate budget. So waiting until January allows for that. In speaking with Gary Kent from Mississauga, he did suggest that as much as they would, the intent would be to table the budget in December, it allows council the opportunity to reflect on it and still debate it and extend the debate into the new year so that they're closer to the regional budget. Hope that helps.
Thank you. Yes, that helps. And do we have a time frame for when the province is coming down with their budget? I know their March budget was obviously pushed back, and the world has completely changed. So when are we going to get a sense of what's coming down from the provincial budget that will affect us? I guess.
Sure, I can take that.
Yeah, you know what I'm asking, right?
Yeah, just in the past week, and I can't remember which day it was anymore, the Premier did announce that they're still committed to bringing the 2020 budget to on November 15th of this year. So this is this year's budget, way back in November 15th. I don't know what will happen in next year's budget, whether they come back in 5 months with another budget, or whether they do a 1.5 or 2 year budget. But they're still seem to be committed to November 15th.
So they're doing the November 15th budget for 2020 that should have been done in March. So how can we budget for 2021? Are they going to give? Are they going to give us projections for the 2021 numbers in that November timeframe, because the timelines are so inconsistent with our budgeting timelines.
Typically, the province would include forward-looking forecasts, given the timing of November, and I think the federal government's debating the same thing. They're getting asked that questions in the press conferences about when are you going to release the budget. It's difficult to release a budget today because they simply just don't know what to expect and where the money's going and how quickly the economy will recover. So I do think it's prudent on the provincial and federal governments to delay the actual budget, because the budget should be based on better known facts. And today, you need a crystal ball to be able to figure it out.
Right. Okay. Thank you very much.
Thank you, Councillor Sato.
Yes, thank you, Mr. Chair. I've read through the report several times, and maybe I'm missing something in it, but you know, it only refers to staff have worked with external agencies, Peel Regional Police, etc., to obtain approval on the timelines. I really think, given what we have gone through and the fact that we have no idea what our tax increases just for regionally controlled services are going to be, that we need to be giving as a council some stronger direction to those external agencies as they are preparing their budget. You know, I don't want to go through what we did last year, particularly with Peel Regional Police, coming forward with a budget that many of us felt was quite high, and it did influence what we went forward with. It always does. And at that time, you know, we said that we need to be giving strong direction to the Police Services Board to not come forward with huge increases in their budget. I mean, I think after last year's, right after we approved all that money, they got additional funding from the province. So I would hope that that would be accounted for in this year's, but we have no idea what they're spending, what it's being used for, etc. But, you know, I don't know what direction we need to be giving them, but if we were going through a normal budget year, we would be saying we want to look at X% increase next year. Looking at the numbers that you have in here, I don't think these are realistic. The inflation numbers, the 4.3%, etc., the 2.7% base, I don't think those numbers mean anything anymore. You know, so I guess I'm a bit reluctant to say, yes, let's go full steam ahead, you know, let them bring their budgets in, because we all know that every time we've sent something back to, for example, and I'm going to use Police Services Board because that was the biggest one. Every time we've sent it back, we get the answer saying, well, we've looked at it and we're not changing it. So too bad, approve it. So and I don't know, maybe I'm asking you, Mr. Chair, for some I mean, unfortunately, both of the mayors had to leave, so there are representatives along with you on the Police Services Board, so they're not hearing this. But I think the message needs to be very, very clear that these are not normal times. Last year wasn't really normal time, but we swallowed that huge increase. And we all said we didn't want to see it again this year. So how can we manage that without just saying, because in the past we said we were going to have a 4.3% tax increase? You know, that's just not the reality today.
Councillor Sato, if this helps, and I'm sure you recall the conversation from last year, and I know I tread a fine line, and Patrick will jump in accordingly, so wearing the two hats on your behalf at the board and around this table. The first is, you can rest assured that your sentiment has been conveyed to the police, and it is very, very well understood. By the way, in the sentiment that was shared by other members around this table, so that message was conveyed. And if you recall, we had to go back as the mayors and the chair and re-emphasize that. So the sentiment has been conveyed. But such as it is, you'll recall, and Patrick can jump in accordingly, that under the laws of our land, that being the province of Ontario, that moral suasion is about as far as we can go with the police with regards to insisting they do one thing or another with their budgets. They're mandated to do what they think is appropriate. I'm trusting they're listening and they're going to do what is appropriate. But I think that's just something that has to play out with sentiments like yours being taken into consideration and quite rightly being voiced at this time. I know that's not the perfect answer, but I hope you can understand it from both perspectives. And I leave it to their good works to try and make the police board proud and to try and make this council proud as well.
Well, and I understand the process, Mr. Chairman, but I guess what I'm asking, neither of the mayors, I think, are here. They both had to leave for the LUMCO meeting. But, you know, I'm asking you as one of our representatives on the Police Services Board to reiterate that feeling very strongly. And particularly, I mean, it would have been bad enough if we hadn't been faced with the pandemic, but particularly knowing or not knowing what the impacts are going to be on our budget for 2021. It is even more critical right now that that message be conveyed to the other agencies that are preparing their budgets, that it's not business as usual. And, you know, we're not going to come forward with 12, 13, 14% tax increases. We're going to need to cut some things. They're going to need to cut. And they should realize that, but you know, we're not a bottomless pit of money here, and this is not the place where the money is going to be found. If there is additional funding being required for policing or anything else, then I think the Police Services Board needs to be looking more towards the province for that funding.
And Councillor Sado,
and I'll leave it at that.
And I respect that, and I appreciate your understanding of my response. I will say again, your message has been conveyed loud and clear to me, and I will leave it at that, other than the fact that I see Commissioner Van Offwegen is on my list. Stephen.
Thank you. Hopefully everybody can hear me. Just to add that in the intent in here is for the external agencies to come forward to regional council in June. So there would certainly be an opportunity again for council to reiterate the message that Councillor Sado is speaking to, if there's a desire to have that opportunity to speak directly to the police chief when he's in, as well as the other external agencies in June.
Okay, thank you. And maybe nobody else around this table agrees with me, but I mean, I thought I heard a lot of concerns last year when we were dealing with the budget that, and we did have the vote at council that sent the budget back. So at least more than 50% of council at that point agreed. So hopefully going forward, I mean, I know it's a very essential service, but again, you know, we're just not that bottomless pit of money.
Councillor Sado, thank you. Madam Clerk, seeing no other speakers on my list, I turn the vote over to you.
Item 8.4 will be considered received, hearing no objections. And 8.5, moved by Councillor Raz, seconded by Councillor Sinclair, that the 2021 budget for regionally controlled services and external agencies be planned and developed in recognition of the economic challenges being faced by taxpayers. And further, that staff work with external agencies to meet the proposed 2021 budget timelines as outlined in the report from the Commissioner of Finance and Chief Financial Officer, titled Revised Update on the Approach to the Development of the 2021 Budget. And further, that the external agencies be requested to report to Regional Council in June 2020 on risks associated with achieving the 2021 budget directions. And further, that the timelines for the 2021 budget deliberations as outlined in Appendix 1 of the subject report be approved. Call the vote. Councillor Carlson.
Yes.
Councillor Carlson in favour. Councillor Demerla. Councillor Demerla. Councillor Dasco.
Yes.
Councillor Dasco in favour. Councillor Dillon.
Yes.
Councillor Dillon in favour. Councillor Downey.
In favor.
Councillor Downey in favour. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes, please.
Councillor Fortini in favor. Councillor Groves? Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
In favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi? Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. I'll circle back. Councillor Demurla? Motion carries. Thank you.
Thank you, and that brings us to item 8.6, the 2020 Development Charges Bylaw Update and Timeline Extension Report. Are there any questions on this report? Seeing none, Madam Clerk, I believe another recorded vote is required. Over to you.
Thank you. A motion moved by Councillor Fortini and seconded by Councillor Paleshi that the Region of Peel Development Charges Bylaw 46-2015, the 2015 bylaw, be permitted to remain in force until the specified date provided for under Section 9.2 of the Development Charge Act 1997 as enacted by Schedule 1 of the Coronavirus COVID-19 Support and Protection Act 2020, that date being 6 months after the day the emergency was declared under Section 7.0.1 of the Emergency Management and Civil Protection Act is terminated. And further, that the timing of the development charge background study being prepared in support of the enactment of a bylaw to replace the 2015 bylaw be adjusted accordingly. I'll take the vote. Councillor Carlson.
Yes.
Councillor Carlson in favor. Councillor Demurla. Councillor Demurla.
Yes.
Councillor Demurla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon.
Yes.
Councillor Dillon in favor. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes.
Councillor Fortini in favor. Councillor Groves.
Yes.
Councillor Groves in favor. Councillor Innes.
Yes.
Councillor Innes in favor. Councillor Kovac.
Yes.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
Yes.
Councillor Starr in favor. Mayor Thompson.
In favor?
Mayor Thompson in favor. Councillor Vicente.
Yes.
Councillor Vicente in favor. Thank you. Carries.
Thank you. On to 8.7, community agencies in receipt of COVID-19 funding. A report here for information. Are there any questions? Councillor Santos.
Thank you. Through you, Mr. Chair, just a very quick question. Will the agencies who have already applied for the 1.2 million, will they need to reapply for the 11.8 moving forward? And then that's it, because the mental health question was answered earlier. I'll wait for May 28th for that one. But just a clarification on if they have to reapply.
through to staff with regards to reapplying for the next tranche of money?
Thank you. Through the chair, thank you for the question. Yes, they will need to reapply. The initial applications were for the $1 million through the Community Investment Program. This most recent tranche of funding has slightly different criteria, excuse me. And we did open up that application process on May the 4th.
Okay, thank you.
Thank you. That is here for receipt. I have no other questioners. It's been moved by Councillor Santos. Do I have a seconder, please? Oh, just receipt. Anyone is fine. Do I have any objectors to receipt? Seeing none, that is carried. Takes us on to 8.8, contract extension for adult and youth shelters. Again, a report before us. Are there any questions? Seeing none, I require recorded vote. Madam Clerk.
Thank you. Motion moved by Councillor Starr and seconded by Mayor Thompson that contract 2013-200P awarded to the Governing Council of the Salvation Army for the operation of Kawartha Road Shelter, Peel Family Shelter, Wilkinson Shelter be extended for an additional 9 months commencing October 1st, 2020 and ending June 30th, 2021. And further, that the contract be increased in the amount of $5,863,228, excluding applicable taxes, in accordance with Procurement Bylaw 30-2018 as amended. And further, that contract 2020-420N for the extension of the operating contract for the Brampton Youth Shelter be awarded to the Governing Council of the Salvation Army for a 6-month period commencing January 1st, 2021 and ending June 30th, 2021 at an estimated cost of $938,961, excluding applicable taxes, in accordance with Procurement Bylaw 30-2018 as amended. And further, that staff be authorized to increase the subject contracts in accordance with the terms of the contract to cover additional costs associated with operation of the shelters to the limit of the Street Emergency Shelter Supports approved budget. Call the vote at this time. Councillor Carlson. Councillor Carlson. Councillor Demerla.
Yes.
Councillor Demerla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon.
Yes.
Councillor Dillon in favor. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes.
Councillor Fortini in favor. Councillor Groves.
Yes.
Councillor Groves in favor. Councillor Innes.
Yes.
Councillor Innes in favor. Councillor Kovac.
Yes.
Councillor Kovac in favor. Councillor Mahoney.
Yes.
Councillor Mahoney in favor. Councillor McFadden.
Yes.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Paleshi.
Yes.
Councillor Paleshi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
Yes.
Councillor Starr in favor. Mayor Thompson.
In favor?
Mayor Thompson in favor. Councillor Vicente.
Yes.
Councillor Vicente in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Motion carries. Thank you.
Thank you. 8.9, procurement response during COVID-19. A report here for information. Any questions? If
Yes,
not,
Mr. Chair, it's Councillor Raz.
please proceed, Councillor Raz.
System, right?
Yeah, I for some reason, Councillor Raz, I don't see you on my screen, on my personal screen, but I'm getting a thumbs up from the technology folks here. So we know you're there, and thanks for your patience and being acknowledged. You have the floor.
Thank you very much. Just a very quick question. As more and more companies pivot towards providing PPE and products that can help address some of the issues related to COVID, how are we how can those companies reach out to the region of Peel and let them know that they have these products now available?
I think.
Through the chair, thank you for the question. Through the, and I think there's an appendix in there that with respect to our logistics section, I don't have the contact information, but we do have information on our website with respect to people wishing to donate PPEs, but there are also through the competitive process when we're doing procurements, and this is one of the things that we're starting to amend in our emergency procedure. Normally in an emergency procedure or policy for procurement, if you're dealing with a water main break, you have to fix it overnight. You don't have time to go through a competitive process. With the pandemic and the ongoing duration, we're still now starting to be in a position where we're able to entertain a little bit more of a competitive process. Certainly through our procurement website would probably be the best place for vendors to get a hold of us if they're wishing to do business with the Region of Peel. And I think that would probably be the most effective way for them. If there's donations, that's a different channel for them. But I think you're referring to the competitive selling of the PPE.
Yes, that's correct. I've had a couple of companies reach out and ask how they could be
and certainly you can direct them to procurement and our logistics team will take a look at it.
Okay, if you can send that contact information to me directly, that'd be greatly appreciated.
We will do that. Thank you.
Thank you, and I'm happy to move the report, Mr. Chair.
And thank you. With no other speakers, that is here just for receipt. Do I have consent on receipt? Does anyone object? Seeing none, that's dealt with. Brings me down to 8.10, the update regarding waste management during COVID-19 emergency declaration. We have an oral presentation, and Councillor Santos, I put you on notice that what we numbered as part of 8.10 and 9.6, your questions regarding the Brampton Sharp would be appropriate at this time after the oral presentation. So 8.10 through to staff.
Thank you, Chair Inika. Good afternoon, everyone. Further to the bi-weekly update provided to Council last week, today serves just as a quick update on our service levels as well as a heads up on the 2 changes we will be implementing in the coming weeks. So before discussing the changes...
Sorry, Mr. Chairman, could he speak up, please? It's very difficult to hear.
Sure. Is that better?
Is that a little better, everyone? Yep, carry on.
Okay, thank you. Sorry about that. So before discussing the changes, I'd like to confirm that overall our waste management services continue to operate well and are being performed as safely as possible in accordance with the safety guidelines published by the province. For the 2-bag exemption, we're still seeing only about 2% of households putting out the extra 2 bags. Yard waste has leveled off after a spike in April, but is expected to increase again as we finally get into some warmer weather in the next couple weeks. At the CRCs, with fees waived, we are seeing some larger load and repeat visit by residents, but all in all, they are operating well. I can't thank our staff enough, our staff and contractors enough for their continued dedication to maintaining these service levels. So in terms of implementing a couple of changes to our services in the coming weeks, they are not large in nature, and with proper communication, we don't believe they will cause much confusion in the community. Per our update last week, we are planning to cancel the June garbage exemption period. Typically, garbage exemption periods occur 3 times a year and are opportunities for residents to dispose of excess garbage. Given we are already collecting 2 extra bags every 2 weeks, a further exemption period seems redundant right now when we are concerned about handling of excess waste at the curb, and this may increase the risk to our collectors. But don't worry, as we've already agreed, staff will introduce an exemption period once it is safe and practical to do so. Communicating of this suspension will begin in the next few days, well in advance of when the exemption period was to take place in June. We wanted to ensure you had a chance to digest our update last week and have this discussion today before communicating any further. And also, as I mentioned in our update, physical distancing does pose a challenge at our CRC sites. Restricts the space we have available for cars and people moving around the site, which can certainly impact the length of lines and wait times. We have not extended the hours of the CRCs yet, like we normally would in May. Unfortunately, we're seeing some periods of high demand, but we're also seeing an equal number where there are virtually no customers and demand is quite low. Therefore, simply extending the hours of the operation may not provide much relief. We continue to review the hours of operation and our customer patterns, but won't be changing to extended hours until at least the 1st of June. We will keep Council in the loop during our bi-weekly updates and bring back any information to Regional Council if deemed fit. And lastly, a few notes on communication. We continue to communicate our waste service levels and changes through our standard channels. And we are also ensuring we are supporting the cities and town with messaging around littering, in particular PPE litter. So that brings me to the end of my update, and I would be happy to take any questions.
Thank you. My list is Santos, Raz, Dasco. Councillor Santos.
So as per the correspondence that was sent based on a motion passed by Brampton City Council yesterday, we are having a significant increase in the number of used needles and sharps in encampment areas, the downtown area of Brampton, as well as near our anchor organizations, Regeneration and Knights Table. Just wondering if Peel Regional staff, if there's a way for us to install some of the sharps containers or receptacles in some of those identified areas during this time of COVID-19?
I think Commissioner Granger is going to take a quick first answer on that from a global public health perspective, and then I'll be happy to support her on the sharps bins when we get there.
Okay, thank you. Through you, Mr. Chair. Thank you for the question, Councillor Santos. As you know, we've done a significant amount of work over the years on this issue in terms of increasing public access to sharps disposal and increasing public awareness with increasing communications, but there's always more work to do. So we are happy to have staff work with your staff to understand the issues and address the immediate problems. And then we were happy to work with all our municipal partners and our community stakeholders on a broader response to continue to enhance support for this issue and bring back a council report in a bit of a longer time period. But I'll turn it over to, I don't know if that works for you, but certainly we will reach out to your staff for the immediate issue. But I'll turn it back over to Commissioner Farr if he has any follow-up things to add. Thank you.
Thanks, Kathy. And Councillor Santos, what I can offer is we do have a contract for sharps disposal that is certainly available for the city to use at their discretion. We have pricing that is available for them. I can have our staff reach out to city staff so that they can take advantage of this vendor system. The vendor will come out, install the bins. They also will come out and clean them up when they are full, and maintain that for as long as we rent the bin. So that is available to the city. We'd be happy to work with you.
Okay, that would be great, and I'm wondering if the region can also step in on that as well. The motion itself calls for an update report from staff to the City of Brampton for May the 27th, just to deal with the more immediate concern and issue. So just flagging that as a potential timeline, but thanks everyone.
Okay, thank you. Councillor Dasco.
Thank you. Through the chair, I just wanted to ask, with regards to the canceling of the June garbage exemption period, will we have some communications to go out with that? Because the last go around in my ward, there was a lot of people putting couches and things like that out. So that I don't think was properly communicated. That's number one. And then number two, people still seem to be putting bulky items out, and I'm just wondering if there's any kind of tags or something like that that we could be putting on these items so people know to take them inside.
So thank you for
That's
your
questions.
Yeah, thanks for your questions, Councillor, and through the chair. For the first one, in terms of communicating related to the exemption period suspension, for sure, that's why we wanted to get in front of it today. It's not scheduled to occur for another month, so we will get on communicating starting early next week so that there's a good 3 to 4 week run up ahead of that. In terms of working with residents when they do put out bulky items, we do ensure our bylaw officers are out there and tagging them and speaking to residents if it's feasible each and every time that they're put out.
Thanks, Andrew. Very much appreciated.
Thank you, Councillor Parrish.
I don't have a question. I just want to compliment both companies that are doing the waste pickup. My truck from Waste Connections appears at 7 a.m. on my street now as it did before all this started. They're doing an amazing job. I sent a letter to the manager, and he posted it in all their employee areas, because he said that they don't get the good feedback very often. But I'm very impressed with what they're doing. In my chat with him, he said that he's bonused all his workers $2 an hour, which is about $125 a week extra, because he appreciates the fact they're showing up to work. So perhaps we could, as a council, send a letter to both companies, letting them know we're very happy with what they're doing, and they're helping keep the city clean and keeping our cities and our town clean, and maybe just draft something quickly to send off on behalf of all of council.
Councillor Parrish, I think that's a great idea. The chair would be happy to also, because I agree with your observation entirely. So that will be taken as direction. Seeing I have no other speakers, this is here for receipt, and we've dealt with Councillor Santos's matter that I'd number 9.6, so that will have been dealt with as well. On the direction of receipt, do I have any objectors? Seeing none, that's been received, and thanks to all. Moving along then, that brings us down to 13, items related to planning and growth management. 13.1, external legal services for regional official plan review matters, transportation corridor protection, and related hearings to be held by, and I believe it was Councillors Paleshi and Raz. Councillor Paleshi?
Thank you, Mr. Chair. And just with respect to the monies that are being requested, I'm a little bit, I don't fully understand why the additional costs with something that has such a high price tag on it currently. And I don't know who the appellants are. Can somebody tell me who the appellants are?
I'm guessing through to Patrick.
Thank you, Councillor Paleshi, for the question, and through you, Mr. Chair. The appellants we're referring to in particular are appellants to Regional Official Plan Amendment number 26, and also those appellants who have challenged Brampton's Official Plan Amendment number 105 in the Secondary Plan 47 area. Those are the matters that remain to be completed, that Mr. Garrett is retained to deal with. Unfortunately, I do not have to hand the list of appellants active on those files, but I'd be happy to report those to you as soon as I could get a hold of them.
Okay, and since this dates back to, I think, as early as 2011, and there's been increases to the budget since then. There's been some resolution, as the report indicates, as the from a total perspective. But I guess any increase that has come by matter of appeals during this time, I'm struggling with first of all the almost $1 million price tag that we're currently looking at. And then indicating that there will be a resolution or a resolve if we do put a further increase on this. And I'm not, I know we've had reports in the past, but I'm not completely up to speed on what the actual issues may be with respect to some of these. So I guess what I'm looking for is a status report to come back to us in the future on what the appeals are about, and also how confident is staff that this is this is the last increase for this appeal.
So thank you, Councillor Paleshi. I think I can help with some context. You mentioned that this goes back a long ways, and that is part of the explanation for the quite large number, in excess of $800,000, that is put forward for full disclosure of the full extent of the services. This goes back some 9 years to the last time that council had an official plan review. You're familiar currently with the quite extensive 2041 municipal comprehensive review process that is in play. The last time that had to be done under the Planning Act, a major review of that nature, it was called proper Peel Regional Official Plan Review, and it led, and many members of council may recall, to Regional Official Plan Amendment 24, which was the big growth management regional official plan that came out of that iteration and had a number of local municipal implications as well. Mr. Garrett represented us through, and successfully represented us through, all of that process, and all of that is included as historical elements of the $800,000 plus figure that you see. This report is looking for an additional approximately $85,000 worth of purchasing authority to put these matters to bed, in the sense that there were legacy issues to be dealt with. And thank you for the question about how confident we are that this is going to put it to bed. What we've still got to deal with are the transportation corridor protection policies that came out of that last regional official plan review process. And those are still hanging out there because the GTA West has been so delayed, so protracted, and is still not tied down, but we anticipate it will be tied down soon. It's a major transportation corridor in the major growth areas of the region for development purposes, and it's been quite disruptive on a number of fronts, both in terms of appeals of regional official plan amendments that Mr. Garrett has dealt with, and local issues associated with transportation corridor protection. We anticipate that those policies can be finished off. The appeals of them can be put to rest with the completion of the GTA West process. The other issue that Mr. Garrett is still looking to finish off is that Brampton OPA 105 appeal that I mentioned in the secondary plan area 47. It's got significant implications for regional arterial road infrastructure in the vicinity of Northeast Brampton, South Bolton. And that is an outstanding matter. That's less predictable in terms of when it's going to be finished off, but it is the other outstanding issue that this request for authority seeks to address.
Okay, thank you for that. So without the, I guess, the list of appellants, and my assumption is that the province is a big part of what we're looking at here. I guess my question, and this kind of goes back to AMO of last year when we had a conversation with transportation and with housing about the appeal that they put on for the northwest area of Brampton, and really that had to do a lot with shale and not so much actual transportation. I'm looking to see if we can maybe reduce the 85,000, and by way of making this a little bit political, and maybe, Mr. Chair, if you could help me out with this. I know, and I think that you've had some discussions around this with the province, and I was led to believe that the province really didn't want to put that appeal on, knowing that, you know, we had the layer of protection at the region, we have a layer of protection at the local municipality, the city of Brampton. I think that, you know, we're protected, and I don't know why the province doesn't feel comfortable with our layers of protection. But maybe, is it possible for you, Mr. Chair, to have that conversation with the province prior to us trying to resolve some of this before this continuing at the LPAT? That's one of my questions. The other question was, given the current situation, how much work is actually being done at the LPAT?
Okay, perhaps Councillor Palesci, I'll try to answer the first question, and you're right, and I thank you for your insight into the file and all the work that you've done. my last conversation with our friends from the province, and I'm going back 90 days or so, perhaps when you and I spoke on the file, it was rather intriguing because it was as though we were all of the same mind. Nobody wanted to hold it up. Everybody understood what the larger objective was. So I had some confidence that we were all on the same side, but now it's gotten bogged down. So let me reapproach that with regards to your second question, the materiality of what's still outstanding, perhaps again through to staff.
Through you, Mr. Chair, the LPAT is, as is most of government, somewhat disrupted by the current COVID situation and is struggling to resume some normal processing of appeals and other matters virtually. So it is expected to impose some delay on the Northwest Brampton matter as others. The Northwest Brampton matter, though, is a separate matter from the subject matter of this report. That is a later breaking appeal. The province's appeal in connection with the shale issue has arisen only in recent times. What we're trying to do here is put to bed, as I said, legacy issues from the last regional official plan review, which haven't been amenable to being finalized because of the GTA West situation.
And thank you for that, Patrick. And yes, I understand the difference between the two. I guess my frustration is with the fact that, again, we're talking about the same area, we're talking about similar issues, and then a separate appeal. When we're, what's before us is, like you said, it's a legacy issue, and I don't see why we need to throw $85,000 to make this even closer to $1 million to put something to bed when we're still just about to go into something else with the province once this is over during the time that we're currently in. It's frustrating that we're seeing dollar figures like this for no reason, when I think that it could have been. I was led to believe that this wasn't going to be an issue back when we had talked about it. I think in last term, and now yet it's creeping its ugly little head before us again, and we have to throw more money at the situation. So I think there's more speakers. I'll yield to them to hear what they have to say. Thank you, Mr. Chair.
Thank you, Councillor Raz.
Oh, thank you very much, Mr. Chair, and thank you for the overview, Patrick. That was a good. You've answered a lot of my questions. I guess from a cost perspective, why there would have been an increase in costs when LPAT isn't resuming, but also given how long this has been going on, at what point do you stop the bleeding for these particular files? But I think it really goes to the heart of the matter, which is we go through these planning processes, and for so many of our files, whether it's here at the City of Mississauga, the amount we spend on legal fees just comes back to bite us, and we're the ones who have to pay the price. So I don't know if you want to comment on that generally, or you've answered my question about end in sight.
Well, I can offer this hopeful observation, which is that with respect to the new process, the Municipal Comprehensive Review for 2041, we have the benefit of a protection from appeals under that process, which we did not enjoy at the time of the last comprehensive review process, what I call the proper process. So we are living with the fallout of the fact that the appeals were possible in those days. And it's this kind of situation, I think, that motivated the province to protect us from appeals on these comprehensive reviews on a go-forward basis. So the fact is, we aren't in control of the appellants making those appeals, and once they're made, they have to be resolved, and there are some still to be resolved here. So we are in the last lap, but we still have some work to do. And then there is a live dispute, this other matter that I've referred to, Brampton OPA 105, where the region is protecting its interests and acting in close collaboration with the city.
Okay. Thank you very much, Patrick. That's all, Mr. Chair.
Thank you, Councillor Parrish.
Sorry, I just didn't take my hand down. I'm bad at that. Sorry.
Oh, Councillor Parrish, you're okay. All right. With that, then, Madam Clerk, this was here for receipt. How do you suggest we proceed? So it's
Mr.
recorded.
Chair, if I may.
Yes. Is that Michael again? Michael, please proceed.
Yes. Thank you, Mr. Chair, and thank you, Patrick, for the last comments. And it's difficult sometimes as a councillor just to say, okay, we'll go a little bit further and with the money that's there. But I appreciate your comments, and I look forward to hopefully in the future putting this matter to rest. Thank you, Mr. Chair. Happy to move.
Thank you, Madam Clerk. Over to you.
Thank you. We have a motion moved by Councillor Paleshi, seconded by Councillor Raz, that the contract, document 2011-239N, awarded to Garrett Pickfield, LLP, for external legal counsel services to defend Peel Region Official Plan Review, Regional Official Plan Amendments at the Ontario Municipal Board, now Local Planning Appeals Tribunal, and related hearings be increased by $85,957.34, excluding applicable taxes, for a new total commitment of $847,957.34, excluding applicable taxes, in accordance with Procurement Bylaw 30-2018 as amended. And further, that authority be granted to the Director of Procurement, upon the advice of the Regional Solicitor, to approve further increases to the contract for retention of legal and other services that may be required to the limit of the approved capital budget in order to achieve the completion of litigation or, subject to the approval of Regional Council, a settlement. I'll call the vote. Mayor Brown? I understand he has returned.
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
In favor?
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Danny is absent. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini? Councillor Fortini? Councillor Groves? Councillor Groves? Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney? Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor?
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. I'll circle back. Councillor Fortini? Councillor Groves? Motion carries. Thank you.
Thank you, and that brings us down to other business and councillor inquiries. The first I have, 21-1, summary note, response to the Ontario Poverty Reduction Strategy consultation. Here for receipt, Councillor Santos had a question.
Thank you. Through you, Chair, this is item 21.1, yes?
Yes, it is.
Okay. So in the actual response to the province, in reading it, I just noticed that under recommendation 3, or under well-being and social inclusion, there isn't that much mention of mental health and mental health support from the province. And the only reason why I keep bringing this up is because we know that after COVID-19, we're going to have to be dealing with mental health issues in Peel and across the province. So just wondering if staff could comment on that and whether or not maybe it was not included because we're happy with the provincial poverty reduction strategy as it addresses mental health?
Through the chair, thank you. It's Janice. I will comment on that. There is a general reference under social well-being and inclusion about ensuring that Peel residents get the supports that they need. But you are correct, Councillor Santos. There isn't a specific recommendation related to mental health. The submission that we have made today is based on the council-endorsed Peel poverty reduction strategy. And so it follows along on the themes of that strategy as it was developed in the community. And they chose to focus their efforts more related to community well-being, income security, and economic opportunity. So you don't necessarily see it highlighted in the strategy, but I can assure you we are continuing to advocate to the province for improved supports and programs for our residents. Thank you.
Okay, thank you so much. And I could appreciate that they maybe didn't bring it up at the time, but I would imagine looking at the statistics post-COVID-19, it might be an emerging issue we're going to have to advocate a little bit stronger on. Thanks so much.
Thank you. Councillor Demerla.
A question on for planning staff. Just wanted to status on, are we still forging ahead with the region looking at the planning? I'm asking this in the context of, I know the city is looking at a plan for Cooksville, the downtown core, and work on the MTSAs, which is the major transit corridors. And I know that can't move forward unless
Councillor Demerla, what I'm going to do is, if that's another inquiry, I'll raise it. We're still dealing with the resolution that I have before me on the matter,
okay.
But I'll come right to you. If you had nothing further on that, I'd like to put this one to bed. Then I will come back to you after I deal with the next one. So if anybody else has anything further on response to the Ontario Poverty Reduction Strategy at this time, last call.
Sure.
Otherwise, it is here for receipt. Hello, does any? Yes.
Hi, sorry, it's Nancy.
Go ahead.
If I may, through the chair, I would just like to provide another comment or another piece of information for Councillor Santos. The other place that while mental health isn't clearly outlined in the poverty strategy, of which we will certainly ensure that it is part of that program, as a region, mental health continues to be an active advocacy piece for the region and for council. So we will definitely work with the province and our community partners from that perspective as well.
Okay, thank you. With that additional background, as I said, it's here for receipt. Does anybody object to the receipt? Seeing none, that has been received. Next on my formal list is Councillor Parrish. I have it as 21.2, Councillor Parrish, matters related to the CAO. Then I will open it up, Councillor Demerla, to others for other inquiries. Councillor Parrish, item 21.2.
Yes, thank you, Chair. We have a new survey. The last one wasn't particularly user-friendly. So we have a new survey going out tomorrow to the 24 councillors and yourself. The way to, first of all, I'd like to thank Councillors Sato and Rass for their input. This one is going to be way more user-friendly. You have several ways of responding. Number one, you can respond electronically, just using your computer or your iPad. Secondly, you can print the survey, fill it out by hand, scan it, and email it back. Thirdly, when it comes out, it will have Judy MacArthur's email on it. You can book an appointment with her for a 5-minute phone call. She'll record your answers, and you just, that's the end of it. We're really trying to get everybody to respond. The last one wasn't responded to very well. And in answer to Sue McFadden's question yesterday, I gave you the wrong answer. You will have to do the new survey because it's quite different. So it's easy though. It'll be very quick. So just hoping everybody responds so we can get the job description nailed down and put out into the world and get this process going. Thank you very much, Chair.
Thank you, Councillor Parrish. And now I open it up to other business inquiries. Councillor Demerla.
I just was wondering if I could get some idea or an update on the status of the official plan review by the region. I ask that because I know my staff are working on an updated plan for Cooksville and the MTSA around Cooksville, and of course it can't go forward without the region in parallel doing their official review. So I just wanted to know if that's ongoing. I know that part of it was public consultations, and I know that in the COVID world, public consultations might have to be done virtually if there's a plan for that. Just generally trying to get an update. Because as you know, I'm still getting applications for development, so that continues, and so I really need to get an understanding of where everything's at.
Perhaps through to Commissioner Smith, I'm thinking, or anybody else that can jump in on that.
Thank you, Mr. Chairman, and thank you for the question. It's Adrian here from Planning. Hopefully you can everyone can hear me.
Yes, we can. Yes, we can. Go ahead.
Great. Thank you. So yes, we have been continuing full steam ahead with our official plan review, municipal comprehensive review. The timing worked out such that we had an extensive round of public consultation that was undertaken at the beginning of March. So we had that under our belt, and we're continuing to work on the technical studies, the background, the policy work. We have been able to engage with some of our kind of key stakeholders to keep that work going through remote access means and heavy use of Skype, which I know we're not alone on. So that work is continuing, and that includes the MTSA work. And you can expect, council can expect for the second meeting in June. We're planning an update on the official plan review and bringing forward the some of the background work and some of the material for the next round of public consultation. So you can expect that update in June, and at that time we'll be providing some context and recommendations and looking at how we can undertake that next round of public consultation given the limitations that we have now and how things might unfold. So you can expect that update in June.
Okay, thank you. My list now thank you. My list now is Raz and Dasco. Councillor Raz.
Thank you very much, Mr. Chair. Glad you saw my hand. I just want to ask a question, and I know we don't have the answer right now, but can you request that Peel Police report back to council and give us an update on street racing, speeding, and what they're doing to address it? I live in an area that is fairly close to the QEW, and we have South Down Road and Lakeshore, and all of them are being used as speedways right now. So in terms of enhanced enforcement, I'm hoping to get an update from Peel Region Police, if we can request that, please.
It will be passed on accordingly. Thank you. Councillor Dasco.
Thank you, through the chair. And one of the just observation I've got to make is to Nancy. Every time I look at you, I think it's a Salvador Dali painting of clocks.
Oh.
It looks, it's very cool backdrop. But I did want to mention and echo what Councillor Raz is saying with regards to speed enforcement, because it has just gotten completely out of control. Drag racing up and down Lakeshore, for example, on other streets. It is just absolutely dangerous as all anything. So definitely echo that. Another question that was posed to me by one of my residents was during this particular, well, I guess in general, but especially now, with constraints and demands on food banks, etc., is there any overtures that could be made towards some of the grocery stores when they have their items that come up for expiry when it comes to perishables, that they might find their way into one of the food banks that is accommodating? Because I've heard from a few folks to see that there are people that have been going and rummaging through the trash cans behind the grocery stores. And also, they're seeing some people have seen a lot of food getting disposed of, and wondering if you might be able to make some kind of overture to put it to some good use.
I don't know who might be able to take a stab at that. I think it's come up in the past as well. Perhaps Commissioner Sheehy?
Thank you. And through you, Chair, I just want to make sure I'm clear on the issue, and it is the donation of food that is going to expire from grocery stores. Is that correct, Councillor?
Yeah, I guess you could look at it a couple of different ways, but sure, we could look at it that way because I would think it's direct.
So we are always open to donations, and there has been a whole structure set up in our Regional Emergency Operations Center to receive donations. So I'm happy to follow up with you offline.
Yeah, that would be great because I think some outreach would be a good idea.
Okay, thank you.
Thank you, Councillor Sinclair.
Yes, I had an inquiry regarding the MOUs for conservation authorities, and when are we going to have a discussion about what it is we want conservation authorities to do for us?
Please proceed.
Well, that's the question. I just,
Okay.
at some point, we need to discuss the entire issue of conservation authorities, and I noticed it's mentioned in a couple of the reports before today.
And
the MOUs may not be completed before the budget for next year. So that's my concern, is the silence.
Yeah, and Ian, I may have a better answer for you. The clerks just advised me we'll be hearing from them in June, our friends from the conservation authorities. So that is fast approaching, and we can deal with it then. I think Commissioner Smith might have an answer as well. Adrian?
Through you, Mr. Chairman, yes, that's something that we're monitoring. We are waiting for guidance from the province in terms of the content and scope of those MOUs that we understand that they're intending to give. So in the meantime, it's just something that we're monitoring and beginning to think about how that might be structured. But until we get that guidance, everybody's kind of keeping an eye on how that'll actually be structured based on that provincial guidance that's coming.
All right, thank you.
Thank you. Commissioner Sheehy, did you have something further on that?
Thank you. No, through the chair, I'm fine with the comments that have been provided.
Thank you. Okay, with that, we've dealt with all the councillor inquiries. That moves us on to bylaws, and Madam Clerk, I turn that over to you.
Moved by Councillor Starr, seconded by Councillor Mahoney, that the bylaw listed on the May 14th, 2020 Regional Council agenda, being bylaw 37-2020, be given the required number of readings, taking as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed thereto. Any objections? Hearing none, it carries.
Thank you. And with that, we move down to in-camera matters. We have 24.3, appointment of a temporary associate medical officer of health. Madam Clerk, the formalities before we go in camera, please.
Thank you. We are moving into closed session. You do not have a video option during in-camera. The screen is locked with the closed session logo. As per the rules of electronic participation, each of you must declare that you will adhere to the confidentiality standards as outlined in the Regional Council Code of Conduct, which provides, when making decisions, the regional chair and members of council will have access to information that may be confidential or contentious. The regional chair and members of council will respect and maintain the confidentiality of information communicated to them in confidence by staff or colleagues. The regional chair and members of council will not disclose a document or information contained within a document provided for use in connection with a closed, in-camera meeting of regional council, a committee of council, or of any body to which the member has been appointed by regional council. The regional chair and members of council will not disclose the deliberations of a closed session without the prior permission of the body holding the closed session. If you cannot make the stated declaration or appropriate arrangements so that any other person cannot see or hear any of the confidential deliberations taking place, please withdraw from the meeting until we have moved back into open sessions. Members who leave the meeting during the in-camera session and attempt to connect back via the dial-in option will be required to send an email to council@peelregion.ca indicating their request to rejoin the meeting. We will temporarily pause the in-camera session and unlock the room to allow you to join. You would be then required to identify yourself upon joining the meeting. With that, if there's a motion to move in camera.
Do I have a motion to move in camera? I believe Councillor Sato has asked. Councillor Sato has moved it. Do I have a seconder to move in camera? Councillor Groves, perhaps?
Councillor Raz.
Oh, Councillor Raz, thank you. That has been moved, Madam Clerk.
A motion moved by Councillor Sato, seconded by Councillor Raz, that council proceed in camera to consider the appointment of a temporary associate medical officer of health. Thank you.
Seeing no objectors to that, that is carried. Thank you. So we are now in camera.
We're out of camera now.
Madam Clerk, there is nothing related to bylaws relating to the in-camera?
Yes,
There
actually,
is.
there is.
Please, back to you.
There's the motion, the in-camera motion, and then the bylaws. So a motion moved by Councillor Sato and seconded by Councillor Parrish that Dr. Nicholas Brandon be appointed as temporary Associate Medical Officer of Health, effective immediately upon the approval of the Minister of Health through to August 31st, 2020, and further, that documentation be provided to the Ministry of Health to apply for funding under the Provincial Medical Officer of Health, Associate Medical Officer of Health compensation initiatives. And I'll call the vote on that. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson? Councillor Carlson? Mayor Crombie? Mayor Crombie? Councillor Demerla?
Yes.
Councillor Demerla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon? Councillor Dillon? Councillor Downey? She perhaps is not back yet. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Jeez, man.
Councillor Groves? Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
Yes.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
Yes.
Councillor Sinclair in favor. Councillor Starr? Councillor Starr? Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. I'll just loop back. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie? Councillor Dillon? Councillor Starr? Motion carries.
Thank you, Madam Clerk. A bylaw to confirm the proceedings?
This is the in-camera bylaw.
Go ahead.
That the bylaw relating to in-camera item 24.2, being bylaw 38-2020, be given the required number of readings, taking as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed thereto. Any objections? Hearing none, carries.
And would you please proceed to confirming bylaw?
Yes, moved by Councillor Raz, second by Councillor McFadden, that bylaw 39-2020 to confirm the proceedings of Regional Council at its meeting held on May 14th, 2020, and to authorize the execution of documents in accordance with the Region of Peel bylaws relating thereto, be given the required number of readings, taking as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed thereto. Any objections? Hearing none, carried.
Thank you. I have a motion to adjourn from Councillor Kovac and Councillor Mahoney. No objectors, all in favor. Thank you all for another good day's work.